Let's start off with public comment tonight. In general, if you signed up on the public comment sheet, you get 3 minutes to speak. Please, no disparaging remarks to any individual or by name or anything like that. If it goes long, we might cut it down a little bit. And the other thing that we've done is, for lack of a better term, we have one anti-mask group that asked to make a presentation. So they will do that in this open microphone section. That'll be 15 minutes, up to 15 minutes. And we have a pro-mask group that asked to make a presentation. They'll have 15 minutes. So we will start off with Danielle Hadley et al., if you don't mind. So step up to one of the microphones. Here's the clicker. We're not going to ignore you. We can see it up there. We can see it on the TVs.
I thought I had more time, so I had more detail I wanted to get into, but let's see. For our opening remarks, oh, sorry.
Closer to the mic.
Yep.
Right up to it.
Okay. So we're going to talk about the efficacy of masks and whether it's necessary and or ethical to mandate them in our schools. We're here to promote and defend parental choice. We're not anti-mask. We're pro-parental choice. And we know what's best for our children, and we don't co-parent with the state or the schools. We believe these mandates are affecting our children in extremely negative ways. We don't appreciate the fact that the information we present is not being considered. So this is the hierarchy of scientific studies. It's a heuristic used to rank relative strength of results obtained from scientific research. And as you can see, there's systematic reviews of RCTs. Those are meta-analysis. You combine a whole bunch of RCTs together to get an average. That's the gold standard for scientific studies, and RCTs in general are right up there. In other words, so expert opinion, as you can see, is at the bottom. Consensus, expert opinion. So in other words, saying listen to the experts is not good enough, and it's not science. It's important to know where our studies fall on the hierarchy when we're referencing them. Okay, yeah, sorry, I have to jump around a little. So the controversy surrounding masks. It needs to be known that the science surrounding masks is not settled, or rather it is, but it's not being collectively agreed upon. Although scientists have been conducting science on the topic for over 100 years, the efficacy is somehow still up for debate. Unfortunately, the science supporting the rejection of mask mandate mentality is being suppressed by mainstream news sources, discredited by biased fact checkers, and ignored entirely by those elected to represent us in our communities, all in the name of stopping the spread of disinformation. But this is not disinformation. This is just information that you don't want to hear. Limiting exposure to new information that doesn't align with existing beliefs is called confirmation bias. It's very irresponsible at a time like this to not consider all the science that's available to us, even if it goes against everything we've been told by the experts. I just hit a button. Oh, okay. So I want to talk about the CDC's evidence to support masks. On their website, they did a science brief where their #1 study listed for supporting masks is this: an investigation of a high-exposure event in which 2 symptomatic ill hairstylists interacted for an average of 15 minutes with each of 139 clients during an 8-day period. Only 67 of those clients agreed to do the experiment and interviews, and the stylists and all the clients universally wore masks in the salon and that were required by local ordinance and company policy at the time, and none of them were infected. So this is a cohort study, which is a type of observational study, and as we know, thanks to our pyramid diagram of the hierarchy of scientific evidence, cohort studies do not rank very well in definitive evidence. There are major limitations to observational studies like chance, bias, or even confusion. This is a diagram from a study that the CDC used as an example of a bad study. It's an RCT study out of Denmark where they created a controlled environment in which a masked group and a non-masked group compared results and transmission, and they found the impact masks had on containing viral spread was insignificant. The CDC claims this RCT study, so their reason for saying this isn't a good study is that it's too small of a study, okay? There was a total of 4,862 subjects, 3,030 participants who were recommended to wear masks, 2,994 who were the control group. Okay, so, their observational study of 2 hairstylists and 67 guests is large enough to be listed as their go-to study in proving masks effective and what they base their mask recommendation off of. But this one of, 4,000 is too small. Okay. So, which brings us to the CDC's disclaimer that they list at the end of all the studies that they recommend or show on their site. So the CDC puts a disclaimer after all their reference studies. So they're not standing by their findings, and they won't even endorse them. It says here they do not necessarily imply endorsement of methods or findings. This is a diagram showing basically anything, common sense type of stuff. Masks are not fit to our faces. They spread out the side, and when we're considering children, obviously children are not wearing their masks even close to as effective as an adult would. Okay. So it addresses, Because this is a respiratory virus and as tiny as the flu, we don't just expel droplets, we expel aerosols, which are not contained by masks. The study goes on to state. So I'm going to skip that because I don't have time. Okay, so there was supposed to be a slide of a meta-analysis that was up there. I don't have it up there, but I'm just looking for it again. Yeah. So there was a study of a meta-analysis of 12 RCTs. For anyone who doesn't understand the significance of what a meta-analysis or systematic review is, it's a collection of all the randomized controlled studies, the gold standard studies, and they compare the findings of them all to find where the conclusions balance out. These are the most complex systematic reviews possible for scientific studies, and this study is exactly that. In this study, they performed quality assessment of evidence of hand hygiene and face mask intervention by using the grading of recommendations, assessment, development, and evaluation approach. Their conclusion, we did not find evidence that surgical type face masks are effective in reducing laboratory confirmed influenza transmission, either when worn by infected persons or by persons in the general community to reduce their susceptibility. Okay. Yeah, I think this is you. Is this you?
Thank you, Danielle. I just want to reiterate that we are not anti-mask. We are actually for parental choice. That is what we are for. I'm going to read through some of these. Really quickly because I want to get through everything. So one of the efficacy studies that we looked at actually was from Dr. Emily Oster. She actually specifically studied Florida, New York, and Massachusetts because two had more serious lockdowns than the other one. And what they found in the end was that ventilation upgrades were the only thing that mattered in Florida. That made a huge difference. New York thought their ventilation upgrades included opening windows, so there was no difference. At the end, we find no correlations with existing mask mandates between the 3 states and the data. The next one was from these are actually not the updated slides that we sent, so this is a little confusing. So I actually want to mention that our CDC director just 2 weeks ago, the former CDC director, Robert Redfield, also mentioned in an interview online, better ventilation in schools, better sanitization, parents using best judgment and not sending kids to school when they or one of their siblings is sick would actually do much better to mitigate the spread of COVID. There was absolutely no data that supports having kids wear masks in school. The next one was from the Wall Street Journal, Mr. Marty McCary, who had excellent resources cites all of the information if anybody wants to go into that article. Believe it or not, we could not find a single retrospective study in question, and its results were inconclusive regarding children wearing masks at school. To summarize some of the short-term and long-term impacts that he had, the psychological damage to the children, lack of facial and emotional signaling is top on the list, especially younger kids. They can't read teachers' faces or expressions with their own classmates on how to pronounce syllables and say words correctly. Kids are easily distracted. They pull on their masks. There's a huge uptick in childhood anxiety, depression, and suicide. Physical harms. We all know that carbon dioxide toxicity in these masks is at levels that's not acceptable for anyone, including everybody in this room, all adults. When masks become moist, you're actually putting bacteria onto that and you're breathing it back in. Headaches, confusions, kids that wear glasses, myself included. If you don't have it positioned correctly, you can't see and your glasses fog up. For kids, that's an issue. Their heart rates and their blood pressures all went up. The Epoch Times, actually also the director of the National Institute of Health, also mentioned, not too long ago, actually last week, he actually said the push to make school children wear masks is not based on scientific data. I actually have a slide that's not in here. I actually think Billerica has reached herd immunity. We have a total population of 43,200. I got this off the town website, so if they're inaccurate, that's where I'm getting my information from. That includes residents under 12 that currently cannot get the vaccine. So based on the total people that have tested positive, who are immune now, and then the residents that have been vaccinated, we've probably reached herd immunity. Also, the number of deaths in Billerica has been 35. I am not downplaying any death, but that is not even 1% of our population. I don't downplay my own father's death, but it's not even 1%. So to make these decisions, we have to look at the hard data. Up here is a graph from Johns Hopkins. They update it weekly. It's the number of inpatient and outpatient beds in ICU and inpatient from Massachusetts. You can pull up every single week. So as of last week, the Friday ending last week, the total beds occupied total was 84%, but only 2.2% of those were in COVID patients. So the rates may be going up, the cases may be going up, but the hospitalization and the deaths are not. This is the ICU capacity. In ICU capacity as of August 22nd, only 7.8% of all Massachusetts hospital beds had a COVID patient. Actually, the non-COVID IC beds occupied almost 900. I want to flip real quick to the vaccine adverse reporting system. That's where all deaths of vaccine-related injuries are logged. Harvard Pilgrim did a study, and only 10% of doctors actually report adverse events related to an injury for a vaccine. There's been 13,000 deaths. This was as of August 13th. The total number is almost 600,000 adverse events. Of that number, 11,565 are from Massachusetts. Of that number, 107 are actually listed as a COVID vaccine death. I personally know someone who is not listed in that number that died from the vaccine. She was a young, healthy woman. Of the total U.S. COVID vaccine deaths, total worldwide, there were 149 that were under age 25, and let's remember that there's been 0 healthy children that have died from COVID. The average flu became non-existent when COVID hit. The same exact week, in the 14th week of the year, which is how they measure it, the 3rd week in March, the spike was all the way up, and then as you can see, it came down substantially, non-existent. The year before, you see the bell curve. This is all cases of all flu. The reason why there's different colors is because flu A and B have multiple strains within A and B, so I selected all flu. You see how it has the bell curve? All viruses follow Farr's law. A virus rises and declines. It is always symmetrical. This is the science. It leaves the same way that it came. You can go back to any year and you can see the bell curve. Interesting, the prior year, the same 3rd week in March, you can see where we were on the downside, but not a significant drop like we did the year of COVID. "74% of the recent mass outbreak that was actually researched by the CDC shows the number of vaccinated people that spread the actual virus, that's the light blue, and the number in dark blue is the people that were unvaccinated that caught COVID from that outbreak. Of the total number of the CDC deaths, this is an additional slide that's not in the packet, the total number of deaths is 614,000. However, that number, the CDC changed quietly the categorization. It not only includes COVID, it also includes pneumonia and influenza. So of the 614,000 deaths, 284,000 are specifically involving flu and pneumonia. They couldn't distinguish between COVID versus flu versus pneumonia. So they are all lumped together, and it says that on the CDC website. The PCR test is so sensitive that the amplification has had to change several times because it's been picking up other viruses. Also, deaths coded under COVID include hospice deaths were all coded as COVID, and it says that on the CDC website. Gunshot-type wound deaths, which includes car accidents and any other type of accident, was automatically included in that count. Now I'll turn it over to Lisa.
Okay, so these are not exactly the slides that we had sent over to you, so I'm not, let me see if I can forward it.
Oh, hold on, let me correct
Yep.
that. These are the slides that were
The,
sent
the,
Monday
the latest
morning,
updated slides that we had
and
sent
I
to you.
did not get an update when I left work, so.
Yeah, no, I'm not trying to disparage it, I'm just trying to say, I might just speak without the slides
fine.
at this point. No, I'm going to just speak without the slides. Okay, so I'm here to discuss the legal perspective of this. We have a 14th Amendment, and in that 14th Amendment, other than the full amendment written, it does state in it that no state shall make or enforce any law which will abridge the privileges or immunities of the citizens of the United States. Nor shall any state deprive any person of life, liberty, or property without due process of law. So, the U.S. Constitution, as it's the highest law of the land, and the 14th Amendment does not allow a state to deprive any person of life or liberty. It stands to reason that all these guidelines, they're not enforceable. And they directly conflict with the citizen's right to the liberty of choosing not to mask or not to put an experimental medicine into your body directly. We have the right to breathe oxygen freely. We have the right to say no to putting rushed experimental vaccines or substances that have already raised unanswered questions, as demonstrated here earlier, in the scientific community, inside our bodies. We as citizens have rights. Now let's think about discrimination. Many of these vaccines have fetal tissue being either used directly in them or being used in the process. There are many religious organizations that find this offensive to their conscience of following their religious rights. So, Congress, under the First Amendment, shall make no law respecting an establishment of a religion or prohibiting the free exercise thereof. I won't read the rest, but certainly putting substances into our body is stopping the exercise of the freedom of religion if you are against aborted fetal tissue. Also, there's a Religious Freedom Restoration Act, and that states that the government shall not substantially burden a person's exercise of religion if the burden results from a rule of general applicability, unless the government shows that the burden furthers a compelling governmental interest, and it is the least restricted means of doing so. I question severely whether these are the least restrictive means. We have suppressed information out there. There were other ways. So, due process. No health order, any of these mandates, have gone through due process. So none of these mandates going through due process has denied each of us our right to be represented by a vote. We are no longer under the Massachusetts state of emergency. The state doesn't even recognize an emergency anymore. The absence of law provides protection from the mandate, as noted in the 14th Amendment already. Okay. Okay, so in the EAU, which is often used in these things, we must look at the fact that when we're not fully informed, as we know data has been suppressed, and the argument has not been debated fully on both sides to shake out the truth, you have the right to accept or refuse. We should not be denied these rights. We know doctors were silenced, okay? There were other treatments. There were other therapeutics. Ivermectin, zinc, vitamin D, hydroxychloroquine, as prescribed by a doctor, is something between a patient and a doctor. The government should not step in between that sacred relationship. Now, these doctors that were so brave to speak to the truth, they're bullied. They've lost their jobs for speaking to the truth, and they've been denied the long-standing practice of safe drug reassignment. This is suppression. Experimental vaccines are mandated, but these known therapeutics have been so suppressed and denied to the public, you're putting the government in between the patient and the doctor. Please stop. Okay. I'm going to end, well, there is a conclusion, but I want to ask the question, why is science, data, and research so important? Well, the reason is that when you have the debate on both sides and you shake out the truth, you get rid of manipulation. I'm going to go back in history to the Nuremberg trials of Hermann Göring as he stood on the witness stand. This is what he said. Naturally, the common people don't want war, but after all, it's leaders of the country who determine the policy, and it's always a simple matter of to drag the people along, whether it is democracy or fascist dictatorship or a parliament or a communist dictatorship, voice or no voice, the people can always be brought to the bidding of leaders. That's easy. So I'm going to go point by point. He further said, all you have to do is tell them that they're being attacked. Well, let's think about this in our situation. COVID-19 and variants have attacked our health. And, as he said, denounce the pacifists for lack of patriotism and exposing the country to danger. Let's put it in our situation. If you do not give up your freedom for others, we are not patriotic and are selfish and dangerous to society. He said it works the same for every country. So I think we need to learn from history that we need to shake out the debate to get to the truth so that there's data on both sides, but we need to know what the truth is, and that comes from the full debate of both sides being presented. So in closing, the burden of proof that masks and vaccine mandates are effective means of controlling the spread of COVID, it's on our town officials and the corresponding committees and boards to show us. You have the opportunity here to make a decision based on science, data, and research. The detriments of being forced to wear a mask or being forced to be put a questionable vaccine into one's body, especially at the school-age children, are far greater than the benefits. But let's have the debate to shake it out. We've provided ample gold standard studies on the efficacy, even though we had to go through quickly, of the risks and the harms of masking. We've exposed compromised data that is being used to push an unscientific narrative. We've outlined our fundamental rights under the First Amendment as citizens of the United States. We entrust our children to the care of Billerica teachers every school year and expect that you will give this full consideration when making decisions that impact our children's health and well-being. People have strong feelings and beliefs about masks and vaccines. Even though the data and the science don't support wearing masks as a means to stop the spread of COVID, I get it. This is something that needs to be shaken out in the debate, but let's not rush into decisions that have effects. For this reason, we firmly stand by our conviction that this decision is solely a parental choice. Don't take us out of the equation, please. Preserve our freedoms. And I suggest to you that you are the thin veil that keeps our children from the potential harm of a confused government right now. Our governments are confused. And even if you rubber stamp what's being pressured from the administration to the state, to you, now to us, I have to question, can you even make a decision, or do you just have to rubber stamp it? Because if you have to just rubber stamp it, your freedom as a committee has been compromised. Thank you.
All right, next we have Ryan Niles.
Thank you, and good evening. Thank you, members of the school committee, for having the opportunity to speak tonight. First, I want to acknowledge that the previous speakers and I are both here speaking to what we believe is in the best interest of our children. That said, I strongly disagree with the core of their arguments and the evidence they cited. Our job as parents and caregivers is to protect our kids, and our most basic job as citizens is to do no harm to the community in which we live. We are at a point when the ongoing risk of coronavirus, especially the Delta variant, requires that in order for us to do those things, we must agree to a universal in-school mask mandate. Tonight, I will touch on 3 points: the importance of returning to full-time in-person learning, the rising threat of COVID-19 to kids due to the Delta variant, and the need for the Billerica Public Schools to implement a K-12 in-school mask mandate to keep kids safe, healthy, and in school, and to protect those that are vulnerable within our community. Returning to full-time in-person learning is important. Kids learn best when they are in school and can interact directly with their teachers and their peers. Schools also provide critical services to kids like free and reduced meals, social, emotional, and mental health support, and the opportunity to physically move their bodies. Having kids in school also enables parents and caregivers to work or work without managing their job in childcare at the same time. Research done by the CDC showed that remote and hybrid learning had detrimental impacts on both children and adults. Parents of young children that attended school virtually were more likely to report poorer mental and emotional health, reduced physical activity, and less time spent with friends than children that attended school in person. Parents of children in virtual school were also more likely to report loss of work, emotional distress, difficulty sleeping, and problems finding childcare. Keeping kids in school is vitally important for their benefit and for the benefit of the broader community. At the same time, we're now facing a new scenario than what we believed would be the case for the start of the school year. The Delta variant poses a new and very real threat to kids. 1,125%. That is the percentage increase in pediatric COVID-19 cases in Massachusetts since the beginning of July. Dr. F. Perry Wilson of Yale Medicine points out that in the month of June, because of the Delta variant, the coronavirus spread 50% faster than the earlier Alpha variant, what we were dealing with earlier this year. That means, without any other protections, like masks, on average, a person with COVID who would have previously infected 2.5 other people now could spread the virus to 3.5 to 4 people. Unvaccinated people are most at risk. You can see the rapid rate of growth we're experiencing in the 0 to 19 age group over a very short period of time on the right-hand side of the chart. Yesterday, the Billerica Board of Health published data that 7 out of the 13 active COVID cases in town for the 0 to 20 age group were kids under the age of 9. This data goes through mid-August when we're still spending most of our time outdoors. I expect that number will climb dramatically as children resume indoor activities like school. Scientists from North Carolina State University created the COVSIM, COVID Simulation Integration Model, for educational leaders in North Carolina. COVSIM is a predictive model that outlines possible scenarios for returning to school and help leaders in North Carolina make decisions about their return to school guidelines. COVSIM determined that without any mitigation strategies in place, up to 90% of students would become infected with the coronavirus within the first 3 months of school. Unvaccinated kids were most profoundly impacted. Universal masking cut the risk to less than 50%, and universal masking and regular COVID testing cut the risk to less than 25%. It's worth noting that the vaccination rate in Billerica is higher than North Carolina for all eligible residents at 66% versus 52%. While it's possible that our overall vaccination rate could lead to a better outcome, it's important to recognize that the vaccination percentage in the 12 to 18 school age range in Billerica is currently at 40%. I've heard the argument that coronavirus isn't harmful to kids and it's no worse than a bad cold. Again, the Delta variant changed the game, and the argument is simply untrue. In a recent interview on Fox News Sunday, Dr. Francis Collins, director of the National Institute of Health, said that the coronavirus is going steeply upward with no signs of having peaked out. More than 400 children, have died of COVID-19, and right now there are more than 2,000 kids in the hospital, many in ICUs. Anybody who tries to tell you, well, don't worry about the kids, the virus won't really bother them, that's not the evidence. As Dr. Collins says, kids are seriously at risk, and it is up to us to protect them. We're seeing headlines from the South where kids have already returned to school, many without protections of vaccines or masks. Pediatric COVID cases are rising, resulting in more hospitalizations and ICU stays. Pediatric ICUs are kids on ventilators. Just because it hasn't happened here does not mean it can't or won't, and even one child sick enough to be hospitalized or on a ventilator is too many. And though most kids may be asymptomatic or have mild symptoms, up to 15% of kids diagnosed with COVID experience long-term COVID side effects with the Delta variant. These symptoms can include fatigue, brain fog, difficulty concentrating, difficulty breathing, joint pain, chest pain, cough, or loss of taste and smell. This looks like missed school, inability to participate in sports or activities, and has significant emotional and mental health impacts on kids. Again, when faced with this as a preventable problem, even one child dealing with these symptoms is too many. Why am I advocating for a K-12 mask mandate? Why am I suggesting that parent choice is not appropriate in this case? Simply said, optional masking is not enough. Protection is greatest when it's done universally. School districts that have gone back to school without a mask mandate are already experiencing positive cases and quarantines. Communities that went back to school without mask mandates are starting to put them back into place. Warren Public Schools in Kentucky had more than 700 students and staff that had to quarantine because of COVID exposure. Warren is now implementing a mask mandate. In Arkansas, where the governor signed a bill preventing mask mandates last spring, there have been over 100 positive cases and 1,200 students and staff that have had to quarantine since returning to school. The governor has since said he regrets signing the bill and is looking into how to reverse the legislation. Experts agree that universal mask mandates offer the best protection for returning to school. Masks reduce the spread of germs by limiting particulates from exhalation and inhalation, which is why they are most effective when worn universally, and less effective when worn only by some and not all. This was studied by the ABC Science Collaborative, a group of doctors from Duke University. The ABC Science Collaborative studied more than 1 million students in North Carolina between March and June 2021. They determined that masks are critical in preventing the spread of coronavirus among unvaccinated populations in schools. In our case, the unvaccinated population is 100% of kids under age 12 and 60% of kids between the ages of 12 and 18. The Journal of American Medicine, an international peer-reviewed, credible medical journal, published an article earlier this year on the effectiveness of mask wearing. The article cited more than 10 real-life case studies that show that masking significantly reduced the spread of infection. The JAMA article also addressed concerns that we often hear about mask wearing, especially as it relates to kids. Concerns that masks are uncomfortable, kids can't read facial expressions or see smiles, or kids have trouble breathing or are exposed to high levels of carbon dioxide. The science shows that young kids are able to make inferences about emotions and social cues. There's no evidence to support that masks cause breathing issues, issues with oxygen saturation, or increased carbon dioxide exposure. There are valid concerns about masks for children that rely on nonverbal communication, for example, students with hearing impairments, and in those instances, there are FDA-approved clear surgical masks available. Aside from the research that shows that masks work, we really need to look no further than our own experience in the Billerica Public Schools last year. Our children returned to and stayed in school during the height of the pandemic. Based on the numbers reported by Mr. Pavova last year, my conclusion is that masking reduced the spread of infection and kept kids safely in school. Oh, that's okay. Keep going. There we go. Thank you. A recent survey of Massachusetts voters from both parties show that a large majority support universal masking in schools. Adults understand the importance of reducing spread for both children and vulnerable members of the community. Children, by and large, also understand and are willing to do their part to protect themselves and others. We're beginning to see universal mask requirements adopted by other towns around us, and last week, Massachusetts Educational Commissioner Jeff Riley asked for authorization to implement a mask mandate until at least October 1st to give time to increase vaccination rates. The board granted that authorization this morning with a 9-1 vote. Go to the next one, please. The bottom line is that given the position we're in, a universal mask mandate is the right thing to do. None of us want to be here. We all want to return to normalcy for our kids and ourselves. We want our kids to return to school, return to playing sports, and see their friends. We want to be able to work ourselves without having to manage competing demands at home. The best chance that we have to be able to do that is to continue to mask until we've had enough people, including kids under 12, receive the vaccine to provide a high enough level of protection in the community. It's not forever, but it is for right now. In conclusion, I fundamentally disagree with the idea that masks can be optional. The science does not support it. The argument of my body, my choice that has been conveniently co-opted for this situation is more accurately your choice, my body. Your decision to forgo a mask for yourself or your child puts other children and people in the community at risk because it reduces the effectiveness of the protection. Even if you argue that kids are not at risk, which I also fundamentally disagree with, you're endangering the lives of others within the community. These kids go home to parents, grandparents, siblings, and loved ones that may be vulnerable to the virus. They also come into contact with others in their community outside of their homes that are vulnerable to infection. I know from speaking with other members of the community that many people in town agree with me, and I also understand that many in this town, most in this room, do not. I don't expect that I will have changed any of their minds, and that was not my purpose in speaking tonight. I'm here speaking directly to you, members of the school committee, and asking for your support. Please do the right thing for the kids in the Billerica Public Schools and for the good of the community of Billerica by supporting a universal K-12 mask mandate. Thank you.
All right, so now we'll get to the quote-unquote regular public input section from the green sign-up sheet. You each have 3 minutes, please. Jim, if you wouldn't mind keeping time. So first is Amanda Morrison.
Hello, my name is Amanda Morrison. I'm a Billerica resident and mother of 2 young children. So I tried sharing some research data, scientific data at the Board of Health meeting. It wasn't heard. I didn't hear anything back from anyone there. So anyways, one of my children started kindergarten at a public school in this town this past year. I was very frustrated by the mask mandate coming out a week before the first day of school. I told myself she was only going 2 full days per week, so it would be okay if she had to wear a mask. I told myself it would be temporary, and I really wanted her to get the full school experience. Then they went back full-time in April this past year to 5 days per week, wearing a mask 6 hours per day. This time, I was feeling incredible guilt sending her with a mask on for that long. I bought the masks with the holes in them so she could breathe as she was having dizzy spells. Those just came home soaking wet with spit, sweat, mucus, and boogers. She was also experiencing crippling anxiety, to the point where I had to physically carry her into school, soaked in tears, because she did not want to have to wear her mask all day. I was trying to put my 5-year-old to bed one night, and she was having nightmares of the pooled testing that went on twice a week. They would take her teacher and her classmates into the hall to COVID swab them. She told me there was a teacher there that didn't want to do this. They forced her to. You can imagine how I felt at that moment. All I wanted was for my daughter to enjoy her first year in public school. I have since pulled her from entering 1st grade in the town of Billerica. Stop saying children are resilient. There are millions of adults seeking counseling for childhood trauma. Stop saying they love their masks. They are being brainwashed to love their masks. Stop making wearing a mask a normal everyday thing. They are not normal. Masks are for sick people. Masks are for healthcare workers. Most children are not sick, and last time I checked, there are no children working in healthcare. Stop threatening us with remote learning. No parent wants that. It should have never happened. I can email you again with all the research-backed studies on how and why masks do not work for the general public and especially for children. Sure, you can change your mask frequently, refrain from touching it. But if it is not an N95 mask and if it does not fit properly and you have not passed a fit test by an expert trained from OSHA, they will not work. You cannot expect children to abide by these mask rules. It is not only harming their immunity, but also their mental stability. They are being taught that they are the reason for others' illnesses. I refuse to set my child on fire to protect you. Adults sacrifice for children, not the other way around. Stop hanging the vaccine over our heads so we can remove our masks. Like stated before, masks do not stop the spread. This is a virus. It is not going away. If people want to get a vaccine, they can get it, and if they do not, they don't have to. You say you want equity, and even started a special group to focus on equity within the schools. This kind of policy says that only if you are vaccinated you can remove your mask. That's the opposite of equity. I urge you to make masking your child an option. Masks are a medical intervention. Parents make medical decisions for their children, not the school, not the town, not the government, or any other organization. Thank you.
Carol Reardon.
Carol Reardon, 18 Pinedale. I'm not here to declare which side of the sand line I stand on because I'm straddling the middle, really. I'm fogging up. I'm here to remind you of something. Education should be our focus. Thankfully, DESE took control of the mask mandate. As an educator, I have a deep respect for DESE, unlike sometimes this board convenes. And the work they do along with the federal and state laws that govern them, and you. I respect their guidance and regulation. Part of the initial guidance regarding mask mandates in the fall clearly stated parents were to take part in a conversation before a decision was made. Instead, what happened, the guidance came out and the next day we had a mask mandate. Decided by one? Okay. A decision that was inclusively made. Conversation includes both majority and minority sides. With conversation and inclusion comes better understanding of each other, of the issues. Remember, your focus is educating our kids. So do not let mask mandates and political sides allow us to forget classrooms are inclusive, kids are not adults, and children and families are not all the same, despite what's been stated here, actually. Some will struggle with either decision, as will their families. We need to meet their struggles with understanding, not discipline. All of us here, parents, board members, students, community members, need to be empathetic to every student's unique needs because they're not the same. Kids are going to struggle with masks. Everyone is neurologically, everyone is built different. Do not assume children are all the same. And if we're using experts, I have a master's degree in education and my undergrad is in development itself. Okay? Be empathetic to every student's unique needs and their family's unique needs. Be clear as a district about what alternatives students have and what protocols will look like. We need to ensure that staff and building principals are setting an example and leading from understanding, not zero tolerance. Not from assumptions on political sides and levels of education and culture and family. We make a lot of assumptions about people. As assumptions about people in politics has replaced regulation and community building. Good school cultures and school councils, you've been hearing from me about that for over a year, would have helped this. And I am hoping this board is going to very quickly build those councils as regulated. Thank you.
Doreen Healy.
Doreen Healy, 53 Baldwin Road, Borica. I don't have a speech as usual. I'm glad everybody's here because we usually don't have a lot of people here. So this is great. I'm here, I'm not for masks, I'm not against masks. I put the mask on because we have police officers outside that I'm respecting myself. And then I'll take it off when I can't breathe. Like last night, I was in this hall and I took my mask off and I'm being told I'm disrespectful. It's not being disrespectful. I couldn't breathe. So I've had 2 heart attacks. I go into AFib. My point here is I was looked on by both sides. So how is a kid going to be looked at with a mask, without a mask? And what are you all going to do to ensure that the kids are safe, not with just the masks, but in general? You guys are sitting up here going, we're going to put a mask on the kid's face and everything's all right. Not every mask. I mean, we don't even know, does it protect us? Does it not protect us? I have family in Florida. The kids are fine. They've survived. They don't even think there's COVID there. So, I mean, we can look at all this side. We don't really know. But I do know we all have to work together. I've said this many times. I don't care what side you are on political, but we need input from the parents, the staff, the stakeholders, the communities, and the kids, these little kids. Did anyone put a survey out to the kids? Do we know what the kids feel like? Can we just assume that in Kentucky, this is what we decided? But you know what? We put something out without that input. And like Carol just said, you all don't even know about the councils really, how the councils work, school councils. We don't even have agendas that are at the town hall. We don't have meeting minutes. So, but that's important information. We all have to work together. So what we have done and the state has done, Odessa, the commissioner, let's put all the kids back into school. Has he put all his staff back into work? Because I know that they're remotely working. But we're not throwing those back in, but we're gonna have those meetings in person. So these people that aren't involved don't know that those people aren't working. But we wanna throw the kids back in. What about the suicides? What about the overdose? What about all the social emotional issues? And you know what, in fairness to you all, I don't have to like you all, I don't have to not like you, but you're in a tough position. But if you all, like we elected you, you don't stand up for our kids. I can understand with a mask or without a mask, but it should be a parental choice. Because if those people feel so protected by this mask, then they're okay with the person next to them without a mask. I feel on both sides, some need it and some don't need it. But I hope you guys really look into this and stand up for our town with the commissioner. Because I am so disgusted with the commissioner to say all our kids have to go back to school and you don't even know what's going on. And we need to be more proactive on the input on all this, because it's really sad how we've divided this and how I went to a meeting last night and I hate seeing our police officers in our town be disrespected when they're there to protect us. So we all have to work together in this whole mess, because no one knows what's going on. No one knows if it's good or bad. I know you have a timer. I'm used to the timer thing, click off, shut off. So, I mean, let's work together on this and stop dividing people and look for our kids and the staff, because that's why we're there, to teach our kids and make sure they're safe. But we're gonna leave all the windows open because I guess there's no shooters during COVID, but we're gonna worry about putting a mask on their face. So let's all work together on this, please. Thank you.
Liz McGrory.
Good evening. Thank you for giving me the opportunity to speak tonight. Unless you're a parent with a child currently in a school system, you don't understand the feeling we all have in the pit of our stomachs that tells us we're going backwards, not forwards. We're sending mixed signals to our children. And that's not wise during a time of crisis when we should be modeling courage and wisdom. Putting masks on children until our vaccine rates go from a certain percentage to a higher percentage is an unfair punishment. The mask mandate is punishing a body of people who have no control over the outcome. Kids have no control over adults. We all know that, right? When I spoke at the Board of Health meeting the other night and shared that mask breaks were promised but not always fulfilled, the superintendent said he wished I had spoken up. Why would I do that when I know that the teachers are stuck between a rock and a hard spot? They have one of the toughest jobs right now. Why would I be the tattletale? Plus, I'm not going to keep a report card constantly asking my kids, did you have a mask break today? That will raise anxiety levels that are already high. So what I would like to know is, if we all have a collective responsibility for all of our students, and that remains at the center of what we do, how will you manage that mask breaks are mandated? Will you ring the bell each period 5 minutes before the official dismissal? Who will keep you accountable for the next few months while this mandate is in place to make sure that mask breaks happen? I'm tired of acting like a full-time teacher. I have my own job to do, and nobody asked for this. But what I want is for the leadership of our teachers to step up and do their jobs. Thank you.
Stephen Rosa.
I've been a resident of this town for nearly half a century. I've watched it change over the years, and I've seen a lot of changes over the last 2 years, we'll say. We were told when this pandemic started that we heard Dr. Fauci report to everyone that masks don't work. They may catch a droplet or two. And then all of a sudden, he switched his feelings that we needed to wear masks for 2 weeks to help the hospitals so that they don't get overrun. We have to flatten the curve. We were told when summertime comes, it'll level out and we will see the typical trends of the flu where it's not as prominent in the summer months. That didn't happen. Then we were told that we need to wear the mask back to school, and we had an uptick in the fall. And now we are here a year and a half, almost 2 years later, and we're still talking about masks. And we're talking about a town that hasn't had a death in over 8 months. We've had 35 deaths, and each one of them is saddening. But of a town that's about 34,000, it's a very small percentage. And to do this, the trauma that you're putting towards our children is ridiculous. My daughter is fearful to go to school. You folks have created this fear in her. She enjoyed school. You put the mask on her, and now she's afraid to go to school. She hates wearing that rag on her face. It comes home every day soaked. It's disgusting. She didn't get the breaks that were promised to her. And I'm sure you'll make promises that they'll happen, but they didn't happen last year. And I don't have much faith that they'll happen this year, because it's all about getting those masks on. And we all know that the slippery slope is coming. It'll be a vaccination mandate. You are forcing our hand as parents. You haven't listened to us at all. I was at the Board of Selectmen's meeting. It was listened there, but all they had to do was tell the Board of Health to review it. The Board of Health had their mind made up prior to that meeting. It wasn't a Board of Health meeting. It was a John Curran meeting. He was controlling that meeting from before inception. He came down and told the chairman to open the meeting and then immediately close it to restore order. And he immediately did that. It was a joke. I'm losing faith in all of you to be doing the right thing for my daughter. I'm getting sick and tired of all the experts and all the name-calling that is happening. I have been told that if I choose not to wear a mask, then I don't have the right to go to the doctors if I get COVID. Because if I don't listen to the doctor's recommendations for wearing a mask, I shouldn't go to the doctor and listen to his recommendation for a cure. This is the divide this is putting in this town, and it's time it stops. These children are being tormented. The anxiety level that these kids are facing to go back to school is off the chart. And it's time that we bring it down from where it is. This town is divided, and that's where government likes us, divided. This is a ridiculous state that we're in right now. Should be parents' choice. Some of you are parents here in town, and your children are your life. Same for us. We care about our children, and it's time that we get to have a say in how we raise our children and stop being dictated to by government. Thank you.
Jennifer Normand.
Good evening. My name is Jennifer Normand. I live on Thoreau Street, and I have 2 kids in the Billerica School District, one at the Dutile and one at the Marshall. My children were both remote last year, and I was really grateful that that was an opportunity available to them, because while some of the other parents have had concerns about their children's anxiety with wearing masks, my children have had anxiety about going to school without protections, and they were very happy and very successful on the remote programs. So I want to thank you guys for the opportunity you gave them last year. I also am here to speak because when the superintendent made the original mask mandate this year, there was a lot of anger against it. And I think the people who didn't speak up much were the people that were happy about it, because you speak out when you're angry. And I think it's important to point out that for everyone who's upset about it, there's someone who's happy about it. So I think it's important to also consider, we're all not going to think the same, but it is important to look at other people and think about everyone's safety, not just your own or your own opinions. Secondarily, I would point out that the school has the right to make decisions about safety. There are rules against running in the schools because of the danger to children getting hurt. There's no pushing, there's no shoving, there's no bullying. These are rules that are accepted by everyone as important to protect the children. There are rules against weapons in the school. Again, nobody is stepping forward and saying that parents should be able to send their kids in with weapons. This doesn't strike me as being any different than the rest of the rules that are already in place to protect the children, that the school board and the schools, and the state for that matter, have the right to set forth these steps that would protect every child who is trying to get an education in the public school. Lastly, my sister lives in Florida, and she went back to school. Her daughter started, 11 days ago, 12 days ago. Last night, while I was watching the Board of Selectmen hearing, dealing with some of this as well, she was watching an emergency meeting being held in Duval County about this same issue. And the schools in Florida, as you are likely aware, people are losing jobs, they're losing funding, because they're not supposed to impose mask mandates. Despite that, the Duval County School District last night voted to impose a mask mandate based purely on the numbers that they were looking at right now. And what they indicated in their slideshow was that in last year, from 20 to 21, there were 2,500 cases approximately. They broke that down into 9-day counts of 18 cases. There were mask mandates in place even in the schools in Florida last year. This year, the 9-day count was 589 cases without a mask mandate. That include 611 students, and that include 106 staff. I think that we should take the real-world application of what we're seeing in other places and use it to make the best decision possible for our families and our community. And when the opportunity comes for children to be vaccinated, for those that choose to, then okay, but right now there's no other choice. They don't have the chance. My kids can't go get vaccinated right now. So the least that can be done to protect them without the ability for them to stay home remotely this year is for everyone to wear a mask and protect the safety of everyone else in the school. We live in a society where individual freedoms may be important, but society is important. So for those reasons, I would like to say I am very grateful for the original decision, and I am pleased about what DESE did today, and I hope that the mask mandate stays in place so that my kids are also provided the opportunity to experience safety in school, and I thank you for your time.
Michelle Milo.
I'm going to take my mask off because I mumble quite a bit, so it's a lot harder to hear me with the mask on. It's nothing out of disrespect for anyone. I would just like to start off by saying thank you to each and every one of you for meeting with us tonight and listening to the community's concerns. We really appreciate it. For those of you who have the mentality that part of the solution to ending COVID-19 is to force children to wear masks and vaccinate them, I want you to seriously think twice about this. Why should the youngest members of society be carrying the heaviest of the burdens? I keep hearing the phrase, children are resilient. These are innocent children. We are the adults, and we should never be forcing them to do anything like this. They absolutely need skills. I'm sorry, hold on, I skipped over a few lines. Why should the youngest members of society be carrying the heaviest of burdens? They're innocent children, and while they absolutely need the skill, sorry, I have just totally lost my everything. Okay, I'm going to start off again. Why should the youngest members of society be carrying the heaviest of burdens? I keep hearing the phrase, children are resilient. They're innocent children. They deserve the choice that we all have. Okay, hold on. I see what I did here. Okay. They absolutely need to be resilient. They need to learn the skill in life, okay? This is something that they'll have to do, try to get through all the challenges. We as the adults should never be forcing them to acquire this. I repeat, we should not be forcing them to be resilient. This is something they learn with time and experience. By instilling fear that they're going to kill someone, which no child should ever have to worry about, they're making them feel unsafe and creating massive anxiety. Has anyone tried finding a child psychologist lately? Anybody? Because you can't. All right. I actually called around numerous towns trying to find one, and the wait time is 6 months plus, if you can even find one with that. These kids have already been through so much, and they shouldn't have ever had to carry the burden of this virus. This is their childhood. They don't get these days back, and they've already suffered enough. While I agree, we should protect each other as a community, absolutely, when we can. No one should be forced to do something when there are risks involved. By mandating masks and pushing vaccinations, you're dismissing the damaging physical and mental health impacts on our community. For example, deteriorating mental health, which will lead to greater excess mortality in years to come. Drug addiction, alcoholism, suicide, all of these things that our children are already suffering. You're going to see this in tenfold. I can guarantee you this. I see over 200 children every single day, and let me tell you that not one of them, not one, wears that mask correctly. If anything, it makes them touch their face even more. They're pulling it down, they're licking it, they're talking to other kids, and then they're putting it back up. Their hands that have touched other things that have already been contaminated with coronavirus, then they're touching their mask, and then they're putting their hands in their mouth. These are children. They're gross. They're supposed to be gross to help their immune systems build up. All right? Furthermore, it should not be the burden of the teacher to take away any attention from their lessons to constantly tell them to wear it correctly. And by no means should a teacher be forced to reprimand or discipline any child who does not wear their mask the wrong way. It's not their job. Their job is there to teach our children. This is their job. They don't want to be sitting there yelling at children to behave either. It's not their job. Their job is to teach. We're being held hostage to more and more mutations that are being used to manipulate us to take away our freedoms. This vaccine is the greatest experiment that has ever been performed in the history of medicine. We are being pushed a narrative that is not based on decades of immunology. I will leave you all to think about this. When does this end? When does this end? When we are above the 75% threshold for vaccination rate that the Board of Health is demanding? Even then, even when that threshold is met, we're still 100% able to catch and spread the virus. 100%. It's not, the vaccination it's not something that, it's not 100%. In fact, with the different variants, it's already been proven to go down. Are we all supposed to just keep getting a new booster shot? when, you know, the COVID vaccine isn't effective anymore? Just keep getting it every 6 months? What about the children who refuse to vaccinate? Will they just be wearing a mask forever? The answer is none of you know, because we're all just taking this day by day. It's time to stop moving the goalpost. We've seen this happen for the last 2 years. It was 2 weeks. Then it was, well, we're just gonna wear a mask for another year. And here we are again. I'm gonna leave you this one last thing. We refuse to be conditioned to view our freedom as being selfish. There's absolutely nothing that I hate more than having to be told that I'm selfish for not wanting to wear this mask. I will give and do anything for anyone in this whole room. But if there's risk, there should be a choice. That's it. Thank you very much.
John Meneghini.
John Meneghini from 33 Timber Creek Lane in Billerica. So, ladies and gentlemen, I understand this is a hard situation, and everything that I'm seeing and hearing, it all comes down to this. The facts are in dispute. Last night at the Select Board meeting, Selectman Conway made a very impassioned speech, talked about face masks, vaccinations, how these things were essential. They needed to, they were needed for us. Everybody should need them. Everybody should want them. This is going to save us. This is going to protect us, basically, is the message. When people were upset during the public hearing last week, they were upset because apparently I wasn't there, but I was told that, some of the people weren't paying attention. They were looking at their phones. Selectman Conway suggested, well, maybe they were doing their research. Maybe they were Googling their research. So this is the problem. There's a growing group of people in our society, in our town, in our nation, in the world, who don't believe that Google is the source of all truth. There's growing, and if you listen to the arguments, it all comes down to this. It's like one side is going to quote their sources, the CDC, Mr. Fauci, the NIH, the President of the United States. I don't care which side it is, one side or the other. The facts are in dispute. From my perspective, I listen to my friends, my brothers and sisters who immigrated from China. And I say, how do you negotiate the truth, in communist China where everything is all propaganda, the media is all, and they say it's easy. You find out, you listen to what it is that the media is trying to suppress, what it is that, so Google, I've watched Google change their algorithm slowly over the last 5 years. It's completely and totally transformed, okay? I stopped listening to cable news 10 years ago. I stopped paying attention to YouTube and Google. I don't even use Google. So there's more and more people who are convinced that these resources are not reliable, and the more censorship that people see, the less and less they trust that. So this is a really hard situation because, you're in the middle where you have to make a decision, and I support this. As was said earlier, you are a representative body, right? And I don't want this to turn into a majority-minority thing because that's not what it's about. But at some point, it has to come down to the truth. It has to come down to there has to be some facts. The facts are in dispute. So what I have brought tonight that I would like to submit to you is an article which I've read about. I learned about this article from a course that I audited from a professor, a New York University professor, who was running a course on propaganda. And he mentioned this research paper, which was done in April of 2020 by a PhD researcher. Okay, I searched for this for 2 hours last night. You're not going to find it on Google. I finally, using 3 or 4 different other search engines and all kinds of tricks I know because I'm pretty good with computers, I'm a software engineer, I was finally able to locate this thing. I would like to submit this to you. What this is between 1989 and 2019. there were about 10 peer-reviewed research papers that researched the question of face masks. Were face masks actually effective in preventing the transmission of respiratory viruses? Okay? Now, and these are all documented in here. These are all footnoted and documented. You can actually go to the original source material. You can find the research papers. The point is, there were 10 of these things that were produced, and pretty much uniformly, the consensus was that face masks were not. And this is science, right? This isn't something that the CDC said or that the NIH said, and people already talked about the contradictions. So for me, this is where I go. I go here. So, like I said, I would like to leave this with you because where I really think that the people here want is they want you to actually do the hard work to actually look into this and you know, is it true that face masks are, and if we're just going to put up the opposite arguments. So that's what I would like to leave with you. I also have a more contemporary article by a doctor, a medical doctor who I've been following for 10 years, right? Similar thing here. I'll be happy to send you soft copies of that. I'll send that all to you, and I submit that for your consideration.
Thank you. Sandra Brigham.
Last Wednesday, we received the Board of Health's new public health town-wide mask mandate. Today, Commissioner Jeffrey Riley issued a mask mandate for public school students age 5 and above, staff, and all grades. This cannot be enforced. Now is the time you must question yourselves. Are you going to be on the side of good or evil? You must be aware that we have all the damning evidence that this is the greatest scam in our world history. I'm here to make you aware that this is an act of economic warfare and mass genocide. I am speaking for all offspring. I shall not beg the government for something that has already been granted to us by our Creator, which is our unalienable rights, which are protected under the Constitution and secured under your oath of office. Let me repeat that. That is protected and secured under your oath of office. To prevent the damnation of your souls, you must act in defiance of these evil and corrupt mandates being pushed forth, which can only spell out mass poverty and genocide. It is my hope that you act and put down this evil that seeks to condemn and destroy the goodness and well-being of all humanity. Our community. This is our community that we're doing this to. Regardless of your decision, we, the people, have spoken. Hear us loud and clear. This is where we draw the line. Child abuse is never acceptable, and we will no longer tolerate child endangerment from those who swore an oath to educate, nurture, and protect our most precious gift, our posterity. This is not up for debate. We will not be pawns in your game, and neither will our offspring, which is why many parents have already unenrolled their offspring and will now be filing against the surety bonds. Let me say that again. They will unroll if they need to, and we will file against surety bonds. That you are put in place now that harm and injury has reared its ugly head on our offspring. We will not comply. Game over. I'm asking each one of you, what's your position? What is your position? Have you done due diligence? Where did the Board of Health get their data? We want to know how you substantiated this data. Did you substantiate any of what was put up on those slides that I saw at the Board of Health? Here is the draft to show you what we will be doing regarding the Board of Health. You need to read this before voting. And this is a draft petition for grievances against the Board of Health members that we are prepared to file. So it's a draft. I have one for each of you, Mayor. Our legal counsel is currently preparing a similar document to serve everybody on the board. If the board doesn't change direction and rectify this, you will be served after the meeting. So this is open mic. You guys need to vote. We urge you to read this, make your vote. If you don't vote to rectify this, we will be serving you with this. And I hereby put each one of you on notice. Council asked me to say that. And in conclusion, I can say hashtag Free Massachusetts and hashtag We Will Not Comply. Thank you.
All right, Katie Jennings.
Good evening. I read something this morning from the Board of Health, and they used the phrase containment of the virus as if they're trying to contain the virus. Well, that ship has sailed, okay? This thing's out there. If you haven't been exposed to it already, you're going to get exposed to it. So we need a new approach. Everything the experts have done, the masks, the lockdowns, the vaccines aren't working out as planned, okay? It's not working. If we're back to masks after a year and a half, you know, if they work, they probably should have worked the first time, okay? So one solution, someone mentioned it earlier, would be to actually treat the virus, okay? I know it's hard to believe that there's a treatment because the government and the news and most doctors around here will tell you if you get sick, go home, do nothing, and then when you can't breathe, all right, show up at the emergency room, okay? But there is early treatment for it. There are doctors around the country, okay, heroic doctors who are actually treating patients. So that's a route we should probably take, okay? And if people know that there's treatment for the virus, then people won't be afraid. And they won't do things like put masks on school children, okay? And I just ask you to please stop being afraid, or at the very least, please stop punishing our children because the adults are afraid, okay? Also, if you're gonna make kids wear masks because of COVID, okay, you might as well just roll out a plan that they're gonna wear masks all the time, okay? Because the flu's much more dangerous to them. Probably even a cold might be. So is that, you know, where does this end? Is that the end? I mean, okay, all right. And one last thing. Don't wait and see what all the other towns do. Be the first town to stand up, to make a statement and say, all right, say that we're gonna let the parents choose, okay, whether their child should wear a mask. Do it. Do the right thing. Stand up. If you do it, other towns will follow you, okay? Don't be afraid. Okay? Last thing, let the parents choose, because if the mask works and you're wearing one, what do you care if I wear one or not? All right? Thank you.
Teresa English.
Teresa Teresa English, 230 River Street. So I'm wearing multiple hats tonight. I'm a parent of BPS kids, a high school history teacher, and my bachelor's is in biology. As a parent, I'm concerned for my middle schooler, who is too young for the vaccine, and my high schooler, who is vaccinated. I don't want them to feel uncomfortable at school or to struggle to hear their classmates or their teacher. I so desperately wish that things could go back to the way that they were. I'm tired of fighting all these battles. As a teacher, my perspective is different. During the 2018-2019 school year, I watched as wave after wave of the flu swept through the school. Some teachers got both strains of the flu that year. Some kids missed weeks of school, resulting in months of catching up and help after school just to pass their sophomore year. With my background in science and interdisciplinary studies, the recent data and studies show an exciting conclusion. If we had masked up when the flu was going around, it could have been mitigated. All the tissues, hand sanitizers, cough drops, and Clorox wipes that I bought with my own money, that would have been mitigated. Masks are effective at lessening the spread of all viruses spread through respiratory droplets. Here's my history teacher hat. Masks have been used for a really long time. During World War I, the U.S. Army began requiring face masks in military hospitals. During the influenza outbreak of 1918, towns that mandated masks had fewer deaths and illnesses overall. And during the Dust Bowl, it saved lives by keeping dust out of lungs. In parts of Asia, it's considered courteous to wear a mask if you're feeling unwell to protect others. No one likes being told what to do, and I understand bristling against authority. But the motives of us who are in favor of wearing masks have no desire to strip away anyone's liberty. We are clumsily attempting to protect the most vulnerable, the unvaccinated, and everyone else. This virus can be defeated if we collectively get together and wear a mask. As a town meeting rep and concerned member of our community, I'm saddened by the behavior of people who seek to sow anger and mistrust. Our police officers have worked really hard the last week to keep the peace, but they've been treated terribly, shouted at, and flat out ignored. Elected, appointed persons have a difficult job and are tasked with sorting through a lot of rapidly changing information to make the best decision for the town. Most of these positions are unpaid and done out of love for our town. They deserve our respect and gratitude for their service. Wearing masks is the right thing to do, and a mandate is necessary because not everyone shares the same goal. Thank you.
Danielle Sorensen.
Hello, everyone. I'm going to make it short because I did have to bring my kids today. One of them who doesn't want to leave my side, so she will be standing with me. I actually recognize a lot of familiar faces. Thanks for your time. I'm here in support of parents' choice for masking. My children are entering grades 3, 2, and kindergarten, this year. I am a resident and homeowner in Billerica. I have worked in town for over 13 years. I have my bachelor's degree in biomedical science. I love immunology. I love gene studies. I love pathology. So I've been following this virus right along from the beginning. Obviously, there's a lot of different information out there, but one thing that I am seeing that is consistent is that masking the children is not making a change. I also work in a restaurant. I'm a bartender in town, and I've worked there for 13 years. It is true that people can come into the restaurant, sit down right at the bar, and no one's been masked for months, but they can take their mask right off. I mean, that happens almost everywhere. For the kids in school, it concerns me because they need to be able to, one, breathe for their immune systems, first of all. Immune systems are amazing, but in order for them to work, they need to be exposed to germs. And that's real science. It's real science. It's out there everywhere. I do want to, again, I'm just going to be short, but I do have a study from the CDC. It was published May 28th, 2021. It was a large-scale study of COVID transmission in American schools, and it covered 90,000 elementary school students. It basically studied strategies and how it affected the COVID-19 incidents in turn. The strategy of student masking, there was no change. For distancing, there was no change. For hybrid models, there was no change. For classroom barriers, there was no change. For HEPA filters, there was no change. For unvaccinated teacher masking, there was a 30% lower. But again, that wasn't including the children. For improving ventilation, there was a 39% lower COVID-19 incidence as well. So those are things that I do believe, I know the school has been working, but working to make sure that our children are safe. I hope that you're listening to all this great information. I've heard some great talks before me, and I'm happy to also share this data with you via email or whatever you like. And again, just thank you for your time, and I hope that we can eventually make the decision ourselves, because parents deserve to make that decision for our children. Thank you.
Teresa Joyce.
We are here today because we are being stripped of our rights and freedoms. This should not even be a debate. Parents have always been their children's advocate. We, as parents, know what's best for our children, and we don't parent with the government, state, or town. We have been lied to for over a year. First it was 2 weeks, 6 months, lockdowns, closing of small businesses, all while Amazon, Walmart, they all stayed open. Forced masks and vaccines. If masks work, why lockdowns? If lockdowns work, why vaccinations? If vaccinations work, why masks? If masks work, why lockdowns? The cycle will never end until we all stop complying. And we already tried this once. It did not work the first time around. So what makes you think this time will be different? Fun fact, kids are just as likely to die from lightning as they are from COVID. Both are about 1 in a million. We don't have kids walking around wearing special helmets to protect them from lightning. So why are we forcing bacteria-filled, germ-infested masks on our kids? This is straight from the CDC website. During 2020, the proportion of mental health-related emergency department visits among adolescents aged 12 to 17 years increased 31% compared with that during 2019. In May 2020, during COVID-19 pandemic, visits for suspected suicide attempts began to increase among adolescents aged 12 to 17 years, especially females. February 21st through March 20th, 2021, suspected suicide attempt visits were 50.6% higher among girls aged 12 to 17 years than during the same period in 2019. Among boys aged 12 to 17 years, suspected suicide attempt visits increased 3.7%. Why are we ignoring facts? Masks are harmful to our children, mentally, physically, and emotionally. Let our children breathe. Make masks optional.
Danielle Stevens.
Hi. I'm not going to talk about statistics or health risks masks pose on our children's physical and mental health, but I am going to ask you to really think and ask yourself, whose interest do you really have in protecting? Is it really the immune-compromised children? Other power-hungry organizations you fear you have to answer to? Or is it your own personal fears? The immune-compromised children and their families don't have to worry just about COVID virus. They must worry about all viruses, big or small, has the potential to harm them. We have never masked our healthy children to protect them from the flu, common cold, etc. I think we can come up with a better solution to protect the small percentage of immunocompromised children in schools instead of causing more harm on all children by having them breathe the air they should be exhaling out, the bacteria left behind in their mask, amongst other things. You also say we should be focusing on our children's academics. We are. These masks are a big distraction during the day when the children must leave the classroom for extra mask breaks due to panic attacks like my daughter had to last year. Can you honestly say this makes the most and best sense? It's our children's health, and as parents, we know what's best for them. Now, due to the DESA meeting today, I asked to give our children the option to take their masks off at their desks, enforce multiple regular breaks inside, and enforce not to wear them outside. Maybe implement breathing meditation times, because if you really care about our children's health, mental health should be at the top. I pray for all of you for clarity and honesty with yourselves on this. I pray for all our children's healthy and the sick, because in the end, the only one we must all answer to is God. Think about that when you're making your decisions. Thank you.
Brianna Surratt.
Good evening. I am here in regards to masks on the upcoming school year. I understand your responsibilities to create a safe learning environment for all students, but I strongly disagree with your decision to mandate masks. The governor and DESE have not set any mandates regarding masks, only recommendations. I do not believe it is Billerica or anyone else's decision other than parents to cover our children's mouths. Many studies have come out showing how masks can have a negative effect on children emotionally, socially, and physically. This is a medical decision and should be left up to parents. Furthermore, by not requiring staff children's grade 7 and up who are vaccinated to wear masks, you are segregating and dividing our children. As you may know, bullying is already an issue within our schools, as well as depression, anxiety, suicide, many other life-threatening mental illnesses as well. By saying our children and staff who already got the vaccine do not need to wear a mask, you are targeting those who are not and segregating them. I myself have pulled my kids, both my kids, my 7 and my 5-year-old, from public schools due to masks. I don't believe in it. I think it's cruel. I think it's awful, honestly. They no longer want to go to public schools. They don't want to be masked, so I took it upon myself to homeschool both my kids last year and this year. I'll continue to do so until this stops. This has to stop one day, you know? It's just the way it's going to go. Thank you for your time.
Alex Flett.
Alex Flett, I'm on Sycamore Lane. I just always come now. I'm happy and proud of our town for coming and speaking their, thoughts, and it's a big decision for all of you. My son is 3.5, so I did keep him home last year. He would have probably qualified for project support because he did have EI, but I chose not to send him to school, and I'm going to continue with that plan for both children as it currently stands. I am a registered nurse. I've lived in Billerica for 5 years, and I was employed here as a school nurse at the high school. So I understand, obviously the fear and the ideal of public health and proposing a safe environment at schools, but like someone else has also mentioned, there can never be 100% germ-free. So of course we're going to, make the best decisions and promote vaccination or cleanliness or hand hygiene, all of those things to mitigate risk for our immune-compromised students. But they've been living with this for years, and regardless, if I can't send my son to school because I strongly, believe in not masking him, if someone is genuinely concerned about the safety of their child, they need to have that tough decision about whether or not an immune-compromised child is safe in school. Like someone else mentioned, I think the greater benefit of, not to say we do one thing for one child, but I have yet to see actually a child with a medical exemption for immunizations, and we've had children who have recovered from cancer. So not to say they don't exist, but kids who are in active cancer chemo treatment are not in school. So this whole idea of unvaccinated children being there and needing to be protected, a lot of times I haven't seen them. So it's just something to think about. And so I didn't want to prepare a speech, but I'm going to just read some text message conversation I had actually today with another Billerica resident and a friend of my husband's, another wife who is on the polar kind of spectrum of me. And she wanted to reach out to kind of understand where I'm coming from, try to understand why I would be opposed to masking myself and my family. It's always a difficult discussion because, like religion, sincere beliefs become convictions, and without trying to convert someone to our beliefs, it's hard to present info or personal thoughts without making the other feel judged. I don't want to attempt to make you think a certain way, and also can't make the investment right now in providing data or things that support my beliefs, because I'm trying to remain as stress-free in this period of pregnancy. There are many things that go into forming beliefs, of course, but some of mine. I don't believe my family is sick. To distinguish people as only able to remove their mask when vaccinated is setting an image or thought that those who are unvaccinated are carrying disease. I believe the decision on vaccines and masks are separate issues. I determine risk and benefit for any medical choice, but they are also related in what I feared would happen. Accepting mandates on masks is similar to accepting mandates on vaccines. They are both medical choices. They're different than running down the hallway. They're different than a seatbelt. It's a medical choice. And we must support and respect freedom for people to choose what is best for them. This is different, obviously, if you're actively sick with symptoms or present in, say, a hospital. I did wear a mask in the inpatient floors at Tufts last September. My son had brain surgery. But I will surely not want to wear a mask during labor. Those are choices I'm making for myself. So situations also play a role. In the beginning of the pandemic, I wore an N95 mask in public places, even though it wasn't advised. Because if I was truly concerned for myself or others, that is what I would be wearing. The idea of face coverings bothers me. Of course, if you have symptoms, you should stay home. A cloth mask alone is not preventing transmission from sneezes or coughs. It also is a source of holding bacteria, can restrict oxygen and breathing, has many impacts on mental health, speech, and development. I do also want to mention here, I do know someone in town who worked at the convenience store at the end of my street who did pass away within 24 hours of receiving the COVID vaccine. I do know people that died with COVID last year, and I do know someone who died by death of suicide. So I'm taking it in from all perspectives. If I'm not going to get a vaccine for something, I'm also not going to live with a mask on my face for life. I do not believe the risk of transmission while food shopping is high enough that I should protect myself with a mask. And again, I am not sick. To me, the ability to breathe while pregnant is more beneficial. My husband has a documented medical exemption for masks. Going into that area, we must respect and assume when people have medical exemptions or make medical choices, that is the end of the story. Having to defend our choices or discuss medical reasons for things is not appropriate while also supporting medical freedom. I have very strong feelings about masking children. I try not to judge and respect other families for what they do, but I personally feel that is a hard no for me. My son has sensory issues with his head. He also has many medical experiences with masked individuals that end up causing him pain or trauma. I decided last year I will not mask him, in addition to even minimizing his exposure to masks. I found other schools and activities where the adults are also unmasked, as I do not want to normalize that for him. So yes, when people say you should homeschool if you won't vaccinate or mask your kid, that is what we're doing. But I have many concerns about continuing with societal pressures of masking or vaccinating our children. We need to be able to live here and food shop. Or if I am unable to send my child to school, I also don't want him labeled or viewed as a threat or carrying disease just because he is not wearing a mask or has not received a vaccine. It would also be nice to get a tax credit if I'm going to be homeschooling for the long run. I didn't ever plan on that.
Please, wrap it up.
Okay. I understand the current situation is very difficult for many people. I respect we all have different beliefs. I support you in making your choices. I've actually stepped down from advocating and fighting in many senses. I think legislation in Massachusetts will inevitably come. I'm now here always to point out and accept our new path that this is a human rights issue. That experience alone, I used to vaccinate my child, but information and beliefs have changed my mind. That puts me in a different place, I know, for perhaps other people to be more hesitant or question or just follow policies. But I think that impacts my perspective, and the vast majority of people live on the other side. So I don't want to make this political ever. I now found myself in a place trying to defend medical choices and human rights, which is frustrating that the majority of people don't see it in that sense. That's it. I just want to say, even in the mask mandates on schools, it shouldn't be the parents that are angry at each other. It's coming from the state, I know. But labels like anti-vax, anti-mask, conspiracy theorists, I do believe are used to further divide and discredit me and the values of people with medical freedom.
We're at 7 minutes.
Okay, I can go. Thank you so much.
Yep. Dana Aurelio.
My name is Christina Aurelio. I've been a resident of this town for about 17, 18 years or so. I really haven't got much to say. Honestly, I emailed everybody. I told you how I felt about it. I don't know about you guys, but I've lost multiple nights of sleep over this. I've been crying my eyes out. You can ask people in this room, calling them, looking for help. What is going on? What are we doing with these kids? Why are we forcing them to wear masks that we don't know if they work, if they don't work? My stance is they don't. I understand that your stance is that they do. I get it. We have data from both sides. But I personally have a son that cannot wear this mask. It affects his schooling. He's way behind. He's a second grader, going into second grade, and reads at the end of a kindergartner level, almost maybe first grade. That's sad. That's really sad. We need to focus on education. It's our jobs to do that and work together as a team, parents and school committee and superintendent. I appreciate your time. Thank you.
Jerry Payne.
Testing. Hi, my name is Jerry Payne. I have a degree in electrical engineering. I worked for Texas Instruments for many years. I was a reliability and quality engineer for the semiconductor group. I have an expertise in semiconductor process control. I understand statistics. I moved to Billerica in 2007 from Texas. I love this town. I really did. It reminded me a lot of my home state. I have a son who's 18 years old. We homeschooled him because we felt that was the best way to educate our son. Not because we had anything against the Billerica School District, but we went ahead and homeschooled him. He graduated at 18 years old from Middlesex Community College with a degree in chemistry with honors. He is the outstanding science student in Middlesex. He is now going to be attending University of Massachusetts Amherst on their chemistry program in the honors program. So I'm very proud of my son. But I understand what everybody's going through. I don't have a dog in this hunt right now in Billerica, but I felt it was right for me to stand up here and talk. I talked in Windham, Maine, with a colleague of mine and Dr. Shiva Ayyadurai on the mask mandates. Basically, if you look at all the studies, if you look at the science, if you look at all the controlled random trial studies, which are the gold standard for medical research, the bottom line is the masks don't work. Ma'am, that mask you have on your face right there, that was a surgical mask. Surgical masks were designed to keep spit from the doctors from going in the wounds. That's what they're designed to do. They weren't designed to stop the transmission of germs, and they didn't even know what viruses were back then. Viruses are so small, there's no way that you can stop the viruses with the cloth mask that you have and the surgical mask that you have. It just doesn't work. You can look at all the studies, and I can provide you with studies. They don't work. And not only do they not work, they also degrade your health. Dr. Shiva Ayyadurai and his colleague, Dr. Prabhakar Danakar, have original research paper that they did in Dr. Shiva's company they own, Cytosol. And Cytosol is a company that models the human body, and they ran the studies on the human body. And what they found were masks. When you wear a mask for an extended period of time, it changes the pH of your mouth, and that changes the microbiome of your mouth. And your microbiome of your mouth, if you can go to any dentist and find this out, that it affects your overall health of your entire body. So by wearing these masks for extended periods of time, you are affecting the health of your entire body for the most vulnerable people in our society, which are children. So the masks affect not only their physical health, it also, as we've discussed earlier, it affects their mental development and their emotional and mental health as well. So what you guys are doing by causing these children to wear masks is you are affecting their health in a negative way, both mentally, physically, and emotionally. And one more thing I'd like to say before I leave tonight is the Third Circuit Court of Appeals ruled in Owing versus the City of Independence that you guys don't have qualified immunity. If you guys make decisions that affect the health of these children, the people out here have the right to sue you in civil court financially. And I want to leave that with you tonight, guys. I mean, this insanity has got to stop. I know the most dangerous thing that these people over here who are afraid and want to wear masks, the most dangerous thing you do every day is you get in a car and drive around. That's much more dangerous than the coronavirus. If you got in your car and drove around, you know, you were taking your life in your hands. If you really want to stop the transmission of germs, forget the mask, wear hazmat suits. That's what you need to do. I mean, this is getting out of control. I ask you guys to stand up for the people's rights here in Billerica and make a stand. Thank you.
Marcus Greer.
It's Marcus Greet. I just wanted to say to you guys, I think that one of the goals that we have here, especially as school committee, is to make sure that we get students back in the classroom, back in seats, back where they will be able to learn in the best environment possible. Back in February of 2019, my son was in school and ended up catching flu from another student who happened to go into school, even though he already had the flu and knew that he had the flu, but came in and ended up transmitting it to my son as well as several other people in the school. That caused my son to have to miss a couple of weeks worth of school and perform his duties outside and in an unconducive environment. And what we're seeing with some of the stuff that's already happened in Florida, Texas, and Louisiana, with these school districts that have opened before us, is that when they haven't had this mask mandate in process, they've ended up falling into a situation where they've had to quarantine or even shut down the entire school because of large cohorts that have ended up getting the coronavirus and have become sick. And so if our goal is to try and keep students in school where they can learn the best, where they're not going to have to be sent back home in order to and get some secondary form of education or the form sent home, here's your worksheets for while you're working from home, then we should be thinking about masks as a simple way to start that process to help keep everybody in school. Because the real factor here is that it's not just about our own kids, it's about those kids that are around us, it's about the family members who aren't necessarily in a position where they're going to be able to take the time off of work. They might be working the second shift right now and aren't able to come in here and express to you how difficult it would be for them to find alternative care if their child were to become sick or ill. And so that's one of the reasons why I'm in support of continuing to have masks within our school for this particular event. And I hope that we're able to get past it and we can get back to normal. This is my wife. She'd like to use up a little bit of the rest of my time, if that's all right.
Hi, my name's Kendra Pulsifer Greep. I want to start out by saying that anybody who's homeschooling their kids right now, I wish you all the best and good luck and all of the extra patience that you can find, because it is difficult and each kid responds to public school and homeschooling differently. They're all individuals, but the school board's job
is to look at the whole and to educate our kids and to help us educate our kids. That means them, our school board and our teachers making good decisions, but us as well, trying to set good examples. The emotional toll all the way around is real, but we can do better as parents by taking the volume down, taking some of the heat out of when we speak to each other about each other. That's on us to do for our children. The school board needs to remember that none of these kids live alone. I don't want the school board to make a decision because they were bullied. I don't want the school board to make a decision because they are afraid of a lawsuit. I want the school board to look at the school year and do their best to have a successful school year. That is not just about funding, not just about testing. That's about the whole community. That includes your teachers. That includes the teachers' children. That includes all of our families. Just because we don't know a child has died does not mean that there's not a ripple effect. The emotional toll from losing a classmate who dies when they're in high school is lifelong. To sit through a graduation ceremony where there is a cap and gown on a child's seat because they are not there because they have died is heartbreaking and lifelong grief. Because we know that the coronavirus is stronger than the flu, has more complications, those students who are immune compromised, their parents who are immune compromised, are more likely to be severely hurt by it. But even if a healthy person gets it, we're seeing long COVID and we're not seeing, oh, tick these boxes. That brain fog is real. If you got the flu in 2019 through the school district, that B strain of flu had a brain fog with it. It is a severe thing, but it was short term. The brain fog that patients are describing to their doctors is similar to that, but longer. So your students who get sick with it will have a hard time continuing their education until that goes away. It's prolonged even afterwards. Part of them learning is on the school board and the teachers as well as the parents. Please base it on rational thought. Take into account any suggestions that make sense from the parents, but ultimately, you have to do what's right for the school as a whole. Thank you.
Okay, that wraps up public comment. We're going to move on.
Oh, fun.
All right, thank you, everybody. Go ahead, if you would. Just name and address. Mary, does Mary have your name and address?
Yes.
Okay.
Hi, my name's Lisa Yannicki. I live on 4 Hargene Road.
Be closer to the mic, please.
Sorry.
There you go.
A little nervous. Sorry, I came in a little late, and I know everybody's heated, and it's very emotional. It's my husband, Andrew. I just wanted to, I'll keep it brief because I know everybody's been going on and on, but my son is an elementary school student, and that age group is not yet eligible to be vaccinated. Whether you fall on the side of vaccinating or not, whether you fall on the side of being masked or not, that's neither here nor there. But I just wanted to bring up, I know there are issues all the way around the board, and I, for one, kept my son home virtually last year. I can't thank you enough for allowing for that option. We live in a multi-generational family home with my mother, who is 77, my sister, who is 51 and a heart transplant patient, and my nephew, who is 30 and who is autistic, my son, and ourselves. We are blessed and able to work from home. I know there are many that are not, and I understand the need to have schools open. I know that there are 2 virtual schools that are approved in the state, and I have submitted my son, but those schools are both over subscribed, as they call it. So I have 2 questions. One, if, I know you have to make a decision, and that's fine, but if you aren't going to allow, whether you allow for masks or not, which I'm a little confused about that, I was a little late, so sorry, but why not allow, if we have the choice as parents to allow masks for our children or not, why not allow for us to also have the option of being virtual? I know children, not just my own, for other parents and families across the town who have other similar immune suppressed systems, and their children are very afraid to come to school, and not because of the chatter in town, but because we as parents cannot protect our children from hearing all of the discussion for the last 17 months. So it's out there, regardless of whether or not we get heated in a debate tonight, or if we go home and we turn on the news. It's there. They know it. They're little people. They're really smart, and they want to know what's going on because mommy and daddy are upset. So, with that said, I think that we should also be allowed as parents to choose to maintain a virtual option. I know you've already decided that you don't want to do that, and I understand there are many, many people who need their children in school because they don't have the ability to work from home, or they don't. I get it. I totally get it. It's really difficult all the way around. But if we as a school district are not going to allow for that virtual option, then will DESE open the capacity for the cap in the virtual schools that are already available to all of us, regardless of whether or not, what? Stop it. Regardless of whether or not, we can want to take advantage of it or not. They're there. It's already in place. Just raise the cap for those of us who do have immune-suppressed families at home, who understand that not everybody says, oh, a mask is a great idea. They're entitled to their beliefs. But so am I, as a mother who is protecting not just my son, thinking of every elementary school student specifically, because everyone 12 and over, that's a different discussion from me. But for our elementary school kids, our youngest learners, it's our job to protect them which I know that's what you're trying to do, and I respect you for it, and I thank you so much for all of the hard work that you have done over the last 17 months. It's not easy, and I wouldn't want to be in your shoes by any stretch. And I appreciate you listening. I had a whole thing written, but that's not necessary. Y'all are very, you know what's going on, and I just, I think a virtual option might be helpful as another avenue. Thank you.
Okay, the next agenda item is approval of minutes. Darlene, you want to table that one? Yep.
Yes, Mr. Chairman, if we could table that, please. Yes, if we could table that, please.
All right, everybody okay with that? We'll table that till the next meeting. All right, Tim, DESE update?
Thank you, Mr. Chairman. So the update from the Department of Education, I'm going to break into three parts. First is the vote that took place this morning at the Board of Elementary and Secondary Education regarding face coverings. The second part is around protocols for responding to COVID-19 scenarios. And the third part is around COVID testing in schools, including what is now being rebranded as routine COVID safety checks, formerly known as pooled testing. I can talk about that in the third part of this presentation. The first part this morning, as the committee is aware, the Board of Elementary and Secondary Education voted to grant DESE Commissioner Riley the authority to mandate masks for all public K-12 students, educators, and staff through October 1st. That authority is granted by Mass General Law, Chapter 69, Section 1B, which grants the board the authority to promulgate regulations. In particular, 603 CMR 2708 is the regulation that allows for the change in learning time regulations and the implementation of safety standards under exigent circumstances, which is what the board voted this morning. That mandate will be issued tomorrow. At some point during the day tomorrow, is my understanding from the latest information I got, that will be effective with the date of tomorrow, August 25th, 2021. So I want to be clear, as a mandate that comes from the State Department of Education, this board does not have jurisdictional authority to move on that. That is the mandate that is coming directly from the State Board of Education. From what we know right now, recognizing that the mandate has not been formally sent out, after October 1st, schools would have the option to lift the mask requirement for vaccinated students and staff. If the school meets a certain vaccination rate, that would be 80% of students and staff in a school building, but that masks, according to the BESE vote, would still be required for unvaccinated students and staff. I want to be clear that that has been shared in a conceptual form, but not in a logistic form yet. Once that mandate comes out from the Commissioner's office, I will certainly share that with the committee and members of the community. The district will be gathering information about the vaccination status of students and staff in the first few weeks of school. We have had conversation around staff in particular, and those will be forthcoming. For students, we will do that as part of the general information gathering that we do. We're able to access some information through the state systems, but we'll be reaching out to parents directly for validation of vaccination status, and hopefully they will share that with us one way or the other. The mandate from BESE does include exceptions for students who cannot wear masks due to medical conditions or behavioral needs. That's consistent with the practice that we had in effect last year, and consistent with the existing school committee policy. The state mandate will be subject to review at future BESE meetings. I know their next meeting is sometime in September. I don't know the exact date off of the top of my head, but they will be meeting to convene about that in September. The second part of the presentation this evening is around the protocols for COVID-19 scenarios. And the first thing that is fundamentally important, because I know this was addressed in some of the comments around other issues in the past with flu, the same principle should always apply, that students and staff should stay home if they are sick. Those are the symptoms. I think we've said these repeatedly over the last 17, 18 months, but particularly those top four are those that are most critical. Anybody who has a fever of 100 degrees or higher, chills or shaking chills, difficulty breathing or shortness of breath, a new loss of taste or smell, muscle aches or body aches, and then some of those other things, cough that is not due to some other chronic condition, or sore throat, nausea, headache, fatigue, or nasal congestion if it's in conjunction with other symptoms. Really, I think this is one of the things that there are some changes here around close contacts, and this is important for families to know, families and students and staff to know as we go into the coming year. The formal definition of close contact is still the same as it was previously, which are individuals who've been within 6 feet of a COVID-19 positive individual while indoors for at least 15 minutes during a 24-hour period. But what I want to be clear about is those that we're going to identify as actionable close contacts has changed. So there are certain categories of individuals that are exempted from testing and quarantine response protocols, which I'll go through what those are in a second. So when we will continue to communicate out positive cases and impacts of close contacts to the community, but our communications will only focus on actionable close contacts, which means those that are impacted by being close contacts, not those that need to do additional steps. The other fourth bullet here, and I'll talk more about this in a minute, is that the new close contact protocols provide the ability for students to remain in school if they are subject to testing. Certainly the conversation around how do positive students impact the ability of their peers to remain in school, this is a new avenue that allows us to do regular testing of students with parental consent and only with active parental consent that would allow those students, if they're identified as close contacts, to remain in school. So here are the exemptions. Anybody that falls into one of these four categories would be exempt from the testing and quarantine response protocols. And I will say we will put out these slides publicly tomorrow. I know some people are taking pictures, so if it's easier, we'll put these out tomorrow. Anybody who is asymptomatic and fully vaccinated is exempt from the close contact protocols. Anybody who is in a classroom close contact when the distance is at least 3 feet and both individuals are masked is exempt from the close contact protocols. And again, these are promulgated by the Department of Public Health. School bus close contacts are exempt. The reason why is everybody by federal law has to remain masked on a school bus, and windows need to be open on buses, so bus close contacts are exempt from close contact guidance. And any close contact who's been positive for COVID-19 within the past 90 days would be exempt. So here's unfortunately where things get a little bit complicated, and I'm not crazy about the way that this has been put out, and my understanding is that DESE will put out a flowchart version of this that is much more friendly for parents in the future. We don't have it yet. So you will see we have protocol A, B1, B2, B3, C1, and C2 that I'm going to go through. It's a little confusing. But again, we'll put out these slides, and we'll probably do a video voiceover in the near future for parents as well. So protocol A is for positive individuals. Anybody that tests positive for COVID-19, and I would say these apply equally to students and staff in buildings. The duration, regardless of vaccination status, is isolated for a minimum of 10 days after either symptom onset or a positive test result if they're asymptomatic. Individuals can return to school after 10 days once they've been fever-free without medication, experienced improvement in other symptoms, or if they're not meeting those criteria through clearance from a medical professional. But individuals do not need to go through a second PCR test in order to return to school. It's not recommended for positive individuals. So here's the new protocol called Test and Stay. So protocol B1, which is how the state is defining this, this is the recommended protocol. So if I am a student or a staff member who's identified as an actionable close contact in school, I am allowed to remain under this protocol to stay in school as opposed to having to quarantine at home. The duration of this protocol lasts for 7 days from the date of exposure. You have to be asymptomatic, so if you're exhibiting any symptoms, you have to stay home. You have to wear masks in schools at all times other than eating or drinking, and when you're eating or drinking, you need to maintain a minimum of 3 feet of distance, and we'll work with our principals about identifying different areas in buildings. We've already talked about that. Some students will be comfortable being closer at lunch, some students will be less comfortable, so we're making some adjustments to our seating arrangements during lunch times for that. Students, if they're following this protocol, would need to take a rapid antigen test daily upon arrival to school and receive a negative test result. So we were already doing rapid antigen tests. The test we're using is Binax now. That was already done in schools last year. We get results within 15 minutes. So a student comes in, goes to the nurse's office, takes a test. If the test is negative, they can remain in school without having to be home and quarantining. Students should still quarantine on weekends during duration, but that's outside of the school's jurisdiction on weekends, clearly. And then the families and students would need to conduct active monitoring for symptoms through day 14 of exposure. Again, the advantage of this protocol is it provides a greater opportunity to keep kids in school, which should be our primary focus and our primary responsibility. Protocol B2, which is the traditional protocol that we were using last year, and in this case, it would be declining the ability for in-school testing, declining the test and stay option. Quarantine would be at least 7 days. Students could return to school as long as they were asymptomatic, received an external COVID test, either PCR or antigen, on day 5 or later and receive a negative result and would continue to monitor for symptoms. And then protocol B3, if they decline all testing, would be that they would need to quarantine for 10 days and then return after 10 days of quarantine, as long as they haven't experienced any symptoms up to that point in time. Protocol C is for symptomatic individuals, and again, I apologize for all the terminology and the labeling of this. Again, we're hoping this comes out with greater clarity from DESE in the future. So if you are experiencing symptoms, this applies regardless of vaccination status. The duration depends upon symptom resolution. I will mention that the protocols that were in place last year still apply. If somebody starts to feel sick while they're in school, they'll go to the nurse's office, they'll be initially triaged. If the symptoms are of a level where it's suspicion that there is COVID, that there's potential positive COVID case, we have the option of doing a rapid antigen test while in school to determine whether or not close contact tracing should start immediately. But the individual should still go home and can return to school after they received a negative PCR test result for COVID-19. And as long as they have improvement in symptoms and have been fever-free for at least 24 hours without medication. If the individual declines testing, then it remains isolation for at least 10 days from symptom onset. Again, we encourage testing in these cases because it allows us to identify if there is an impact on themselves and on others. So since we've been talking about testing, let me move to part 3, which is around COVID testing in schools. The district will be, well, let me just refer to routine COVID safety checks. This has been formerly known as pool testing. This is the new terminology that's being used. I realize that this will sound as a little bit of, it's not my terminology. Apparently, DESE, after using the terminology of pool testing for 9 months, decided that that was unclear to parents, so we're now using the phrase routine COVID safety checks. But if pool testing worked for you before, you can still call it pool testing, but this is the new terminology we're being asked to use. This is an optional opportunity for parents, for families, for staff, where district will be providing the option for students and staff to participate in routine, that should say routine, not routing, my apologies, routine COVID safety checks, previously called pool testing. Any kind of testing in the schools can only be done with active consent of families and staff. If parents have not signed off on testing, we cannot conduct testing. We're going to send consent forms home to families at the beginning of the year, and one consent form applies to all 3 forms of testing. We recognize that some families may prefer some forms of testing and not others. We do not have the ability to alter the consent forms because they're coming from the state, but if a family chooses to only participate in some type of testing and not others, we will provide those options to families so they can make that choice. So students and staff who participate in routine COVID safety checks will be tested weekly. Just from a logistical perspective, we've got 8 schools. We'll do 2 schools each day, Monday through Thursday, or Tuesday through Friday if there's a holiday. Individuals will generally self-swab, although we recognize that some children may need help. A change from last year is that 2 swabs will be collected for each tested individual. Previously, what happened last year is a student would swab once, it would go into a tube with other, 5 to 10 other individuals, and then if that tube came back negative, everybody's okay. If that tube comes back positive, we would then have to go to those 5 to 10 individuals in that pool and then conduct a rapid test for all of them. That led to some, what I would say is not great situations where we might have to pull a number of students out of class simultaneously. We would test them all at the same time and everybody would return but one. That is not a great way of doing things. So by doing 2 swabs right now, this allows for the first swab to be tested as part of a pool. If that pool is positive, everybody in that pool, their second swab would be tested individually, and the positive individual will be identified at the lab without the need for that sort of pulling everybody out of class situation we had last year. I think this is a really great improvement in terms of the way that this is conducted because it minimizes the in-school impact of the pool sample collection. This is actually what I just talked about. If the pool is negative, everybody's presumed negative can remain in school. If a pool is positive, those individual things will be tested at the lab. And the most important thing is with the double swab, there's no need for follow-up rapid antigen testing in schools. It's important to note that all forms of testing are being paid for by the state. There is no impact to local tax dollars as it relates to this or to the local school department's budget. That is routine COVID safety checks. That is antigen testing for test and stay. That's antigen testing for symptomatic individuals. And the state is also paying for third-party staffing through a vendor known as CIC and through their sub-vendors to support testing, including a testing coordinator, individuals who are conducting the testing, and lab courier services. We know the impact that this had on our staff to be able to do this. And at the same time, having that level of third-party support means that the staff that we have, particularly our nurses, can focus on doing the work that they need to do with students inside of the buildings, as opposed to doing the testing services. So with that being said, I'll leave the slides up as the committee potentially has questions around this. So if I need to go back to something, I can go back. If you ask me a question that I don't have on the slides, I may need to go to Jill's laptop because we're doing double duty right now. But I'm happy to answer any questions from the committee.
All right, Annette, do you want to start?
I do like the protocol B, but I guess one question I had is the vaccinated people are kind of taken out of that mix, but vaccinated people can still get COVID, so why aren't we testing them if they're close contacts?
So what I would say is that as it relates to pretty much this entire conversation, right? I think I want to acknowledge that nobody on this committee, nobody on this side of the table is an expert in epidemiology. These are the protocols that are promulgated by the Department of Public Health. They establish the protocols, and those are the protocols that follow, and it's their guidance. So I can't speak to the specifics of why, but that is identified in their protocols.
That's all I have for right now. Thank you.
Mike?
So my head's spinning kind of from the changes, and I'm familiar with the changes. So I guess for me, the million-dollar question is, what's the level of kind of training and responsibility that's going to put on each individual school? Because that's significant. I mean, the changes that are made are significant. As a building leader in another district, this is the part that I'm the most nervous about reopening, because there's multiple layers that we have to, I feel like there's so many paths that I could take the wrong path, right? And it just runs through me and my school nurse. So I'm just wondering if it's going to be similar in the schools or if there's going to be a different path for kind of ownership of this process.
Yeah, so last week we held our administrative retreat right here in Town Hall. So it's an administrative training, all of our principals, assistant principals, curriculum coordinators, particularly our coordinator of health services and wellness who runs point, with all of this. We actually had that scheduled and already on the agenda for, I think it was 11 o'clock last Tuesday, was a discussion of this when the state put out their webinar for 11 o'clock last Tuesday. So we actually watched that collectively so we could all gather the information at the same time. We provided some additional time on that agenda last week so that our principals and APs at each level, so all the elementary people got together to talk about how they would work on this, same thing with the middle school people, same thing with the high school team. Certainly we are not going to have every answer right now. That work is going to continue over the next, 2 weeks until school opens. In terms of some of the opening day work we do with staff, certainly principals will be having those conversations with staff. I think the most important thing as it relates to this is, you're right, the onus and burden on this falls more than anybody else on the principal, the assistant principals, and the nurses in each building. That being said, the fact that we have that coordinator of health services and wellness position, we have a lead nurse position, who both, did an incredible job running point in this last year, make sure that we have some consistency and coordination across schools. I think above and beyond that, really the focus is we want to make sure that those people that are able to do that, that's where the nexus of responsibility lies. It doesn't fall on the classroom teachers, because their job should be focusing, as has been talked about during the course of this today, on teaching and learning, and not on implementing COVID protocols. So that's the approach that we're going to take. It's around, we have regular conversations as admin team. I'm assuming that this will be a standing agenda item on us, is just to check in. And even if it's not a standing agenda item, it's going to come up organically in conversation anyway. So, thank you.
All right, Jim.
Thank you, Mr. Chairman. I guess my question is concerning routine pool testing and its effectiveness. One of my concerns is I think last year was the lack of participation, or the participation, it was just basically the same students. So I don't know how accurate our results would be if we're just testing a very, very small group of students. And what are we planning on? Do we have any plans to try to increase that participation within our schools?
Yeah, so it's certainly a very valid point, right? I was a little discouraged by the low rates that we had of participation last year. I think one of the things that will help is the fact that we are starting the year with this as opposed to implementing it midstream. Last year, I think this came out, I forget exactly when, but sometime it was, mid to late winter, early spring is when pool testing started. So being able to include this as part of the back-to-school information we send out to families, I think is really important. I think having the fact that there are additional kinds of testing protocols that will allow kids to remain in school, where families are consenting into, for example, test and stay, because again, I think that's a big thing. If that becomes a bridge for more families to help participate in routine COVID safety checks, I think that's a really good and positive thing as well, too. Ultimately, any testing is good testing. While it may not give us the completeness of information around what's going on in the district, it certainly provides at least a foothold into what's happening. And it is an important part of an overall holistic mitigation strategy that we want to be able to try to implement as we move forward.
Thank you. Arlene?
I believe the slide showed 80%. Was that the benchmark?
That is the current benchmark from the state. I want to, I'm guessing the second half of this question actually, let me not presume the second half of the question. Let me just let you make your point.
That's per school or per district?
So that would be my understanding right now, again, recognizing the mandate will come out officially tomorrow, but my understanding at the present time is that is per school.
Okay.
Which means of our schools in the district, I would think realistically the only school that would apply to would be the high school.
Right.
At least until vaccinations become more prevalent, or they get approved for students under 12.
So our elementary school will never reach an 80% benchmark. Our middle schools, where we just redistrict, don't stand a chance of reaching that 80%. So our high school would be the only...
Yeah, so at the present time, at the same time, I want to be clear that that mandate as of right now only exists through October 1st. And so the question about what happens beyond that will be a question for the Board of Education at their next meeting in September. And I don't have a crystal ball to know what's going to happen in the next 4 weeks, whether it relates to virus trajectory or whether it relates to the politics of the state board.
In that 80% benchmark for the high school, I think Annette had mentioned people that already have COVID. When we take that 80%, are we then going to subtract the people who have had COVID and have the immunity, and also any medical exemptions?
Again, my understanding, having not seen the mandate out from the state yet, but my understanding is it only rely on the vaccinated population. It's DESI's rules, so they get to set it how they set it.
That's kind of double worded, but okay. No, not you.
No, I understand that, yeah.
DESI, I mean, if you take 100% and you've got to reach 80, we should be subtracting anybody who's exempt out of that or has had COVID or will never reach that 80%. I know it's not yours.
Yeah, no. So what I would say is there are schools out there right now that I know are already above that 80% threshold in other communities.
Okay. All right. I think it was the last slide you showed, anyone with COVID-19 in the last 90 days does not need to be receive a test?
Anybody who, I think it's this slide you're referring to here?
Yeah.
Yeah, so anybody who was positive for COVID-19 within the past 90 days would be exempt from close contact protocols.
Okay.
And I think that's actually consistent with what the rules were last year as well.
Okay. Yeah, that just kind of goes to prove my point of the first thing of 80%. If they're not counting that to be tested as within the last 90 days, they should take that percentage of people and subtract it from the 100 so we have a chance of reaching the 80. Thank you.
All right, so just to stay kind of in Darlene's line of questioning, the 80% vaccine rate, I think with whatever hat you put on, it would be kind of good to prod at DESI to see if is that going to be what it is month to month. And I know you don't have a crystal ball, but are there other metrics that they could look at?
Yeah, so I would certainly advocate that vaccination rate, just on a personal level, right? I would advocate that vaccination rate should not be the sole determining metric. Case count should be considered, right? Is that, you know, if people are not vaccinated at a higher rate, but there is low incidence of COVID in the community, I would think that that would be an indication that masks should be able to be removed. And again, we will see what the board will promulgate in the future, so.
Okay.
And any ability that I have to personally advocate for that, I will continue to do so.
And just to broaden a little bit on back to school. So to make it clear, it's not us that we don't have the option for fully remote learning. We don't have the option for hybrid learning because...
Yeah, that is correct. So the Department of Education, or DESE, in their information that came out, I believe, late last spring and then confirmed this summer, took the option for districts to offer remote learning off the table, is non-compliant with the state's regulations on time on learning. So we do not have the ability. And to the speaker who spoke about opening up additional spots in virtual schools, again, that's out of this board's jurisdictional authority. I'm not aware of any expansion conversation happening at DESE. So I just want to be able to address that. But.
Okay, and where we don't have the virtual or the hybrid options, if a student is quarantined for X number of days, how do they make up that time on learning?
Yeah, so I think one of the things that we, you know, there are a whole lot of things that were not advantageous that happened over the last 18 months, right? I think we can all, regardless of where anybody is on any other issue, I think we can all agree on that in this room. That being said, I think that the ability and aptitude with which our educators were able to deliver content to students remotely, even if it's in an asynchronous environment through the greater proliferation of Google Classroom or through other techniques, means that we are in a better place to be able to support those students who are home, whether they are positive or whether they're quarantining or isolating, or if they broke their leg, right? I mean, it's not just COVID-related absences, but any child who has an extended long-term absence. We are in a better place to keep those children connected to their schools than we were 18 months ago because of the steps that we took and what we learned from those last 18 months.
On some of the earlier points, mask breaks. Can we make sure this year that we have some mechanism to make sure that they're enforced?
Yeah, it's again, I am hearing the parents who are speaking here, and I've similarly heard this raised. You know, it's something that I've communicated regularly to our principals. It's something our principals communicate regularly to our teachers. I'm unaware of any specific circumstances. Those parents that spoke today, I'll go and look, and I appreciate their conversation. I can go and look and see what sort of retrospectively what may have occurred or not occurred last year. And if that's something we need to work to continue to tighten up. But that being said, it is an expectation in the district without question that students should have the opportunity to have mask breaks.
But to be clear, I'm not saying it shouldn't be punitive to the teacher, right?
Oh, no, of course
Nobody
not.
can do anything unless we, the principal, the administration, the school committee, if we don't know about it, there's nothing we can do, right? So we need to know, and I would start principal, teacher.
Yeah, I mean, as I said when I got asked or when I raised this similarly last week, with any issue that a parent is experiencing with their child, the first point of contact should always be the classroom teacher, whether that's academic, whether that's socially, emotionally, whether that's around masking in this case, whatever it is. That's always the first place to start because your child's teacher has the best connection with your child. And if you don't find the answers there are satisfactory, then you work through the principal. If that's not satisfactory, you work through me. If that's not satisfactory, you go to the committee. I mean, that's the chain of sequence there.
And I'll just assume that with pool testing, if a student is uncomfortable with it and either doesn't want to tell their parents or tells their parents a week later or something like that, it's the same thing.
Yeah, I mean,
teacher, principal.
Yeah, I mean, in terms of, again, where pool test, or again, I want to try to use the common language, routine COVID safety checks.
Pool is easier.
They are not a required thing for students. Parents have to actively opt in. We did have situations last year, I think this happened more with older students, where parents signed their child up to be tested. The students were called down to be tested, and the kids were like, what in the world are you calling me down for? And it said, well, your parents signed you up. Well, I didn't want to do that. And we are not going to force a swab up anybody's nose. I think that's the important thing, right? And if there's a disagreement between the parent and the student, then we can, work through that on an individual basis. But no, we are not going to, we are only going to do with active consent from the family and, direct on-site consent from the student, essentially.
Okay. All right, anybody else have anything else on the DESE update or back to school?
Tim, a parent made a very good point about why don't we just have a scheduled mass break? So just like the bell rings in between classes, the bell will ring for a mass break and it be set. I mean, it's the district's policy that we need to make sure that mass breaks are done. We can't expect our teachers to give up their valuable learning time to start policing mass breaks. Oh, can I fit it in? Can I not fit it in? If it's a scheduled thing, it'll just happen, and then there'll be no question whether someone's doing it.
So I'm actually going to defer to Jill, just because she's been having some conversations around this.
Yeah, so I've been working with principals and around scheduling over the past couple months, and they have been talking about communicating to their staffs about incorporating mass breaks into the schedule. In fact, today I just had a conversation with one of the principals, and that principal is telling me how they were communicating out to staff to be sure to put your mass breaks in your schedule. They can't schedule it for them because every teacher's or grade level schedule varies. So the teachers do need to schedule it in themselves so it fits in their schedule. But principals are making sure that they are putting it in their schedule somewhere.
I mean, that's what we left it up to last year, and I know I heard numerous complaints. I sent emails that were sent to me, and as much as we want to rely on our principals to do that, and our teachers have different schedules, we saw that didn't work last year. So why would we continue to do the same thing? And once again, we're assuming all these schools are different. We're not setting the same policy across the board that says you have to do this and make sure that it's done, because it's all separate islands again. I just don't see that it's going to work. We tried it. Thank you.
All right, we good on the DESE update, everybody? Okay. We move on to discussion on the DESE mask mandate and a potential vote. Who wants to start?
I'd be happy to start.
All right, good.
So, as we just heard the superintendent speak about the DESE mask mandate, we as this board have no say. That the mandate is what the Department of Ed has set down. I have spoken with the superintendent and many of you, and I listened to your concerns. I don't agree with it. I think it should be parent choice. We raise our children from birth. We make all their medical decisions to that point. I wrote down many notes of things that were said at open mic and our presentations, and yeah, it depends on what news channel you're listening to see what your point of view is. And, someone made a good point. Our kids take their cues from us. If we're afraid, they're afraid. If we say it's okay, they say it's okay. I think this is about rights, and parents should have the choice for that. Unfortunately, DESE has tied our hands with that. I would like to see if we could, like someone said, you go into a restaurant, you take your mask off at the table. I didn't see anything in here, unless I'm wrong, Tim, that we can't ask for that to be part of the mandate.
Again, I would say that the language of the mandate has not yet been received, but I would anticipate that would not be consistent from what I'm hearing will be released from the Department of Ed.
And, we're making a group decision for individual medical and family needs. And I think to lump everybody into one group is not the way we should look at this. Personally, I'm vaccinated. My children are vaccinated. I wear a mask often. My child wore a mask before COVID because she's immunocompromised. Every winter, she ends up in the hospital. I don't come to the school department and say, hey, you need to protect my child from the flu. As a parent, I do that. It's my choice, and it's my choice what I do with my child, as it is all of you. And I don't think the school board has the right to mandate what you should be doing with your children. However, the school board does have an obligation to every one of your children to educate them all and to make sure that our schools stay open, that our teachers are healthy. If we don't have teachers, it doesn't matter if you send your kids to school because there's not going to be a teacher there for them. They'll sit in the cafeteria or they'll sit in the auditorium. So we do have to look at the bigger picture of educating all of the students. So I'm not in favor of DESI's mask mandate, but it's what's kind of before us and we can't override it. But I would like this board to consider, after we hear or get the mandate from DESI, to consider allowing the students to only wear their mask in the building in public areas. When they're sitting at their desk, if they're not in, one of the round desks where they're all facing each other, if you're sitting in rows and you're 3 feet apart, I mean, the COVID guidelines of close contact were 3 feet. So why can't they take their mask off? So I would like to present a motion to the board to allow the DESI mandate as is, because we're kind of stuck with it. So the motion would be to allow the DESI mandate to go forward with the addition, if the language provides legally, that our students are allowed to only wear masks in common areas, but not at their desks.
I'll second that. I second it.
Mr. Chairman, if I can just speak for a second on the question of distancing in classrooms. One thing I just want to be clear about, when I did the presentation around the DESI guidance on close contacts, it only applies if students are 3 feet apart, at least 3 feet apart from each other and both masked. The motion as presented would increase the number of close contacts that are actionable in schools because if either student is unmasked, whether it is the person who is positive or the person who is not positive, they will be identified as close contacts if they are within 6 feet, not 3 feet, because that 3 feet only applies if both individuals are masked. The second thing is, while we were able to bring students back to school at 3 feet last spring, we are not able to bring students back at 3 feet to school this fall. The reason why is because there is not a remote option. We have about 650 to 700 more students in school than we did a year ago. So we are not able to guarantee 3 feet of distance inside of classrooms. So I just want to be clear about some facts around this before the committee entertains the motion.
But that doesn't apply to lunchrooms and stuff. A close contact, because they'll be eating and...
Yeah, I mean, the close contacts, close contacts in lunchrooms will be different because students are unmasked. Yeah.
Okay. I still want to go through with the motion. I see no reason. It's no different than the lunchroom, that they can't take their mask off in a classroom. They're sitting in a classroom.
So if this motion were to pass, what happens with DESI? Tim?
Again, it's tough to, I don't really know because I don't know what the guidance actually says. The question is, the motion as I understand it as presented would be that it would allow for unmasking at desks if the DESI guidance allows. Right. I don't know how the committee votes on a hypothetical. I guess that would be the question. I mean, if there is I would say that a more prudent course of action would be if the mandate comes out and that is provided, the committee could call an emergency meeting to consider it. I think that would be a more prudent course of action than voting a hypothetical in the present.
Now, that kind of ties our hands that if DESE doesn't decide they like it and they don't want to put it in there, we can't vote on it. I mean, somebody, I don't recall who it was, but somebody said, you know, and we hear it all the time, Billerica is a leader. We need to stand up and we need to lead and we need to, you know, make decisions for what's best for our district and our students, not look at what's going on just in Florida or Tennessee or, I mean, yeah, we take that all into consideration. However, you know, I'm not going to be fearful of what goes on in another state when, you know, we have stricter mask mandates here in Billerica. So that's supposed to make things better for our community. So there's a lot of things that we need to take into consideration. Other communities don't.
So I would say you just contradicted yourself. You're saying we have stricter mask mandates.
We do.
But you're asking that we allow students to take their masks off, and the potential is they're going to be closer than 3 feet from each other.
It's no different. Our mask mandate in town is that we can go into a restaurant, it's a community area, you walk through, and then you take it off at the table. This is no different than them walking to the cafeteria, sitting in a round table facing each other and taking their mask off. These kids are sitting in rows behind each other and in a classroom. So I don't see the difference of comparison between the lunchroom and the classroom.
So to me, the old definition of a close contact, and we still use it where I work, is over a 24-hour period and 15 minutes of contact with somebody that tests positive. So I understand what you're saying. I just think it's dangerous, not dangerous. It increases risk, which I don't think is a great idea. So
I mean, that will also, you know, and then if a parent wants to tell their child, look, you know, my child personally would probably wear a mask the entire time, no matter what. However, this is kind of like a common ground. I'm trying to find a way for everyone to be safe, be educated, and still have parental choice. So if you want your child to wear a mask in the class, like mine, who would, then you do that. If you don't, then you don't.
all right. Else have any comment on the motion? Tim?
I just don't, I mean, again, we're dealing with a hypothetical here until we actually see what the actual mandate is. And even then, if when the mandate comes down, unless they say what you're proposing, I don't know how we alter that. And again, I mean, this may be a topic for the next meeting we have, after the guidance comes out, to find out what we have, but.
I would be comfortable if we set a meeting for next week or before school starts, after we see the mandate.
And if we're going to do something like that, I think we need to, once again, run this by our legal counsel to find out whether this is an actual thing.
Yeah, I mean, like I said originally in the motion, if it's legally possible. I'm not trying to pull an end run and do something illegal. If it is legally possible, then I would like to see this added in. I mean, we're still going to keep DESE guidelines.
Well, that wouldn't be DESE guidelines at that point, because then you'd be countermanding their mandate.
Well, it's the same thing that the Board of Health did recently, saying that they're leaving it up to the businesses that this is their mandate. You can wear a mask in common areas, but not at your table. You can wear a mask going into the doctors. The businesses decide what the common area is. The businesses decide, you know, Can we do it at the bar? Can we do it here? Can we do it there based on the guidelines, you know, that are being set and what each building is? Like Tim said, some buildings can do 3 feet, some can't.
One of the big differences I see is that between a business or a restaurant or a bar or what have you, is that our children are they're spending an extended amount of time.
That's
far
my
more
point.
far more time than you would be spending in a restaurant or in Market Basket or in O'Connor's, and they would be sitting there with the same children and breathing. You know, I mean, coughing, what have you. You know, that's the difference I see in that.
Yes. I will withdraw the motion pending another meeting before school starts and after we see the DESI guidelines.
I mean, I think for me, even outside the legalities, Darlene, I see what you're saying, but I think 2 things have to happen. Number one, we have to see the guidance.
Right.
So the guidance is the blueprint, right? How is it going to be implemented in each one of the schools is the next question, right? So I know for me, if I'm theoretically thinking of my school with the guidance, I know what it looks like at my school, but that's going to be different than the school that's less than a mile away, right? So that's the next card that needs to fall. So what I think you're looking for is opportunities for kids to take their masks off, right? And I think the public has spoken around their concerns. It was one of my concerns when we came back with kids coming back outside of hybrid, and I brought it up at a few different school committee meetings around scheduled mask breaks. But I think what we have to do is allow the guidance to reach the schools to see how it's going to be implemented, because we might be able to get a win on opportunities for masks to be off. But I don't know what that guidance looks like. I think it's premature at this time to jump and make that leap. But I don't think it's just seeing the guidance. I think it has to reach the school level, and they have to figure out a way that they're going to implement the guidance for us to be able to make any type of decision around adjustments.
Would it be better if they knew what the expectation was before the school year starts? You're a principal, so you could honestly answer that, you know, so
Yeah.
I respect your opinion of that, you know, as an educator and a principal, would it be better if we tried to set, you know, the policy before
Yeah,
the
I
school
think
year
the turnaround,
starts?
the turnaround time is going to have to be fast, right? It's going to have to be really fast. So if the guidance drops tomorrow and we have an opportunity to digest it, my assumption would be that Tim then disseminates that to the building leaders. They're going to have an opportunity to debrief quickly, like they talked about the collaboration that's happened. They have to start making actionable decisions around opening and what that guidance is going to mean directly in their schools and in the classroom. And it's not going to be necessarily the same. Some of those policies and procedures will be the same. Some of it's going to be different. If you can generate increased distancing in certain locations at certain times in the building, that's your built-in mask break, right? But that might not be the same over at the dew tile, right? Let's be honest, the dew tile's configuration is a lot different, right, than the Parker in terms of the setup. So I think we have to allow that to kind of reach the school level. I think principals to process the guidance. I know Tim and Jill are going to oversee that, but I think before we even make a decision, we have to be able to see what it's going to look like in each one of the buildings. But the turnaround has to be lightning fast. It has to be top priority. It has to be the number one thing. When the guidance comes out tomorrow, I'm not waiting for my superintendent to let me know what I need to be doing. I'm going to be looking at that guidance and working with my assistant principal and my leadership team to be able to make changes and adjustments that I need to be able to make to safely open my school. So I think the turnaround has to be fast.
So Mike, I'm sorry, as a building leader in another district, at what point are you focusing your time on learning loss versus these things?
Yeah, I think for me, I have to launch my school in the safest way possible in a way that's equitable for all kids, right? So we're talking about I had 150 kids accessing a summer program at my school where they did not have to wear masks, and now they have to come back in wearing masks. So for me, I have to be able to buffer mask breaks that are scheduled, that families understand, and that teachers are going to make sure that happens. And then I have to walk the beat. I have to go in during those times to make sure that the masks are off so kids are getting what they need, right? That falls on me. So the learning is going to happen, but the stage needs to be set for a safe opening that's going to be equitable so kids get what they need. I know that many residents talked about the impact of mask wearing and how that affects anxiety for kids. One of my things listed down here at a cost to having masks is social emotional development for kids. So there needs to be more groups, conversations with social workers, right? That's a non-negotiable. If you're going to implement your social emotional learning curriculum, this is the time to do it, right? Now, when you have an opportunity where kids are coming back in and things aren't predictable, you have to set the stage for learning to happen in a different way. It's not just about reading, writing, science, and social studies, right? Social emotional learning is real, and this is the time, if you're not implementing it, you have to implement it, and you have to implement it well. So those are all the things that I'm focusing on, even outside of making sure that every kid gets what they need in terms of the true content.
You said you had 150 kids over the summer?
Did.
I know Bill Ricker didn't bother to track it for some reason, but did Lowell track how many of those kids had COVID or
At that time,
contracts?
yeah, it's a great question. So I had 0 rate of positivity at my school. However, my summer program started 3 days after the school year ended in the middle of June, and then went to the middle of July. So at that rate, the COVID positivity in the district that I worked in was a lot different than the current rate of positivity right now. So to be honest with you, I think we dodged a little bit of a bullet with the timing of the program, to be quite honest. I'm proud of the mitigation factors that we had around sanitizing and hand washing and all of those things that we promote. But honestly, the timing was perfect, right? The rate of positivity was at an all-time low in the community that my school is in. It made sense to do that. Now with the increase in my community, similar to Bill Ricca, something different needs to be able to happen to safely open my school, to keep my school open, and to keep everybody safe. So it's a great question, and I know it's a question I'm going to have at my virtual open house for my families on Thursday, and they're going to ask, well, no masks then, so why masks now, right? So I think the data in the local community has to be something that we have to process to make sure that we're as safe as possible. But it was a four-week program with 150 kids, 4 days a week, and no positivity. So that shows that if the positivity is down in the community and you have the other mitigating factors there, there is an opportunity to be mask-free, but the conditions need to be optimal in order for that to happen. And they're less optimal right now.
Okay, thank you.
All right, so we're going to move on. You're going to withdraw your motion until next meeting and after the guidance comes out?
Well, when is the next meeting?
It'll have to be sometime next week.
Yeah, as long as we're having a meeting before school and we see the guidance, I'm comfortable withdrawing the motion until that time.
Everybody good with that? All right. In the meantime, I'll talk to Mike Long. We'll see what he says, and we'll wait for the guidance. Okay, we move on to proposed revision to school committee policy, EBCFA, face coverings. Darlene, this is yours.
So the school committee had signed a policy and voted in one meeting. There wasn't 3 readings. The policy basically says this policy, it's for the superintendent to change the mask mandate or guidelines at any time before the next meeting. So it reads, the policy will remain in place until rescinded by the school committee. However, in recognition that there may be modification to statement guidance about face coverings from the Department of Elementary and Secondary Education, DESE, and/or Department of Public Health, DPH, and take effect prior to scheduled school committee meetings, the superintendent is authorized to take temporary action to ensure compliance with state guidance until such time as the school committee can meet to amend the policy. I would like to change the 2 words from guidance to mandates. Although we hire the superintendent for his expertise, this board is the ones who are responsible for the policies of this district. And I think if there's guidance that's set out, I think we jumped the gun on this one too soon. And if there is a mandate, absolutely. This board needs to follow it, and the superintendent will enforce it and send that out to the parents. But if it's guidance, I think it should be a discussion of the board with consultation with the superintendent. It shouldn't be a superintendent choice. It should be a board choice. So I'd like to make a motion that we change this policy to change those two words from guidance to mandate.
Anybody second that?
I'll second it.
All right, discussion. Annette, anything on the motion?
I agree. I kind of feel like we maybe should have waited a little bit to make any changes to the September masking thing, because it ended up kind of being out of our hands anyway. So I think if we kind of, instead of looking at the strong recommendation, just kind of waited to the things changed, I don't think there would have been as much fighting from the last month that's been going on. So I'd rather have it be a mandate that can be changed, and then if it's something that's a suggestion, I would rather have all of us discuss it to decide if we want to change it or hold off.
Mike?
All right, just so I completely understand. So the mandate I get, right? So the mandate means that we'd have to, right? So the guidance, what you're recommending or suggesting is that if it's guidance, it'd be a level of discussion with the committee, with the superintendent, in order to be able to determine what the next steps would be?
Correct.
Okay.
So as Mike alluded to a little while ago, things move fast during this pandemic. And basically this clause in the policy gives the superintendent the ability to react quickly on the ground. Now, I don't disagree that the earlier statement was maybe a little premature, but that being said, things do change quickly, and we need someone who's in charge. We hired him to make decisions to respond in the best interest of our students. Now, the key word in here is temporary, that he could make a decision, and then we could call in a meeting or a regularly scheduled meeting after that time period and do exactly what we're doing, discussing these terms.
Which is what we did in this case when we originally scheduled this meeting.
And I think, if we rely on simply a mandate, as we've discovered with DESE, they're like turning around a super tanker in the middle of a hurricane sometimes. It's not going to happen very quickly. And sometimes we do need to react quickly to things. We don't know what's coming down the road. Hopefully nothing. Hopefully we get back to where we were, like Mike said, in June and July, where things were on the up and up. But I think the superintendent needs to have that ability to react quickly. And that's not free rein. I mean, we will, after that fact, discuss whether we agree with it or not, and then the change will be made. And we pay him to use his judgments in these situations. So that's why I don't support this.
Okay, so two things. Darlene, you just said if it's a mandate, then we need to follow the mandate. But in the prior discussion, you're trying to change the mandate somewhat, right? So that's a little bit contradictory. And just a reminder, when we changed this from state guidance to, when we had him follow guidance, this was back in the June timeframe when it allowed him to have our summer programs, have the kids go, to Mike's point, go to summer programs without masks. So, and if something changed in the next 2 days miraculously with COVID numbers and DESE kind of bowed out of it, it would allow him to do the same thing, rescind the mask mandate, right? If there was a mask mandate, which there is. So I don't support this either. Just, sorry.
I respect your opinion in that. I just feel that you know, like you said, we hire the superintendent to guide this board. We are the elected officials. We are the ones responsible for the policies. So allowing him to put out guidance opposed to mandates is, what are we needed for?
So, just to correct you, the superintendent does not put out guidance or mandates. He's expected to follow and/or interpret and act, right? It's a subtle difference, but it's a difference. We don't expect him to put out mandates. So, I get it. You ready to take a vote?
Sure.
All right.
If I may, Mr. Chairman,
Tim, I'm sorry.
just for context here, I want to be clear that this is part of the larger policy, EBCFA, around face coverings. The policy, prior to it being implemented, required face coverings, actually originally in all indoor and outdoor spaces in the district. When the policy revision was made in May, we took out, in perpetuity, the outdoor mask provision out of that policy. If this change happens as occurs, it means that my only discretion is to change the school committee's policy if the state issues a mandate. The default position of this policy is that masks are required in schools, in all indoor spaces, which means unless the department issues something that says that masks cannot be required as a mandate, I would not have the discretion to change that. And even if the state says masks can be lifted, the school committee existing policy means that we would need to continue masking students. So I just want to be clear about what the implications are here. Because, and again, it's a temporary basis. Certainly I respect and value the judgment of the committee on this. But this would limit my ability to take masks off of students if this motion passes as promoted.
So it doesn't limit your ability now, but it limits ours? That's kind of backwards. Aren't we the elected board?
So I will remind the committee that when we met on July 29th, during that meeting, that I had shared with the committee that this provision was put in place so that we could be responsive to guidance that was issued by the state. Whether at that point, when it was originally passed in May, to take masks off for summer programming. And when we met on the 29th, we knew that there was going to be something coming out and we would be responsive to that. There was agreement at that meeting that, you know, it would be moving forward with whatever that guidance was. That guidance came out from the state the next day. That was communicated to the community, consistent with what that policy was and what the discussion was on July 29th. Again, that is on a temporary basis until the committee can meet as it is today to take any further action. The concern would be is, let's just, you know, say we have a meeting on, pardon me for that. Say we have a meeting on October 10th. Something comes out on October 11th that says masks can be, masks are no longer required in schools. DESE will not issue a mandate saying that. They would issue guidance saying that it's no longer required. I would not be able to follow that guidance if the change happens here, because the committee would maintain sole authority, and the committee's current sole authority and the policy is passed. The default position is that students are masked. If what you're looking for is a change to the overall default position of the committee, that requires a very different amendment than what you proposed. And that's certainly something the committee could entertain. But the default position of policy EBCFA is that all students would remain masked indoors at all times. And it would take any discretion away from me to deviate from that default position.
Couldn't this board just meet immediately to remove that?
Again, that is an option that the board has. And I just want to be clear about what the implications are of the proposed motion.
I'm comfortable with the motion as it is.
And just to clarify too, as far as calling an immediate meeting, we can't do that. We have to post a meeting and we could, I mean, and we could do that. But in those 2 days, you know, the kids could be without a mask.
No,
in
you
that
legally
interim.
can. Unforeseen circumstances allow a board to set a meeting immediately.
All right, there's a motion on the floor. Darlene wants to go ahead with a vote. So, all those in favor?
Aye.
All those opposed? No?
No.
No.
Okay, the motion fails. Okay, we move on to response to OML complaint. Tim?
The committee
Excuse me, I'm sorry. OML is open meeting law. I apologize.
As a committee is aware, we received a complaint. My apologies for that. We received an open meeting law complaint on August 4th, 2021 that was filed with the town clerk's office. That complaint alleged that the school committee was in violation of open meeting law because there was a public records request for the minutes of the July 29th school committee meeting. As I wrote to the committee on August 4th, the committee has an obligation to discuss the complaint in a public meeting, which is what we are doing right now, and then issue a response to the complainant. As I wrote to the committee, this complaint, which regards a public records request for minutes of the July 29th school committee meeting, is without legal merit. The complainant filed the request because they were informed that at the present time there are no draft minutes that are responsive to a request for public records, as all that exists at the present time are the recording secretary's personal notes of the meeting. Please be aware that the process that is followed for minute creation is that the recording secretary takes personal notes during the meeting and later reviews those notes to create the draft minutes of the meeting. As you will see from the legal references below, those personal notes are exempt from the public records law, but once they are later turned into draft meeting minutes, they then become subject to public records requests. The relevant section of the open meeting law, which can be found in the OML guide on page 19, requires public bodies to create and approve minutes in a timely manner, which is considered to be within the next 3 public body meetings or 30 days from the date of the meeting, whichever is later. So please note here that the open meeting law requires the creation and approval of minutes in a timely manner, which is in 3 public body meetings or 30 days from the date of the meeting, whichever is later. At the time of the filing of the complaint, it was the 6th day since the July 29th school committee meeting. Furthermore, the public records law exemption E allows the withholding of notebooks and other materials prepared by an employee of the Commonwealth which are personal to him and not maintained as part of the files of the governmental unit. An on-point example is the requester sought all documents from a government entity related to a particular issue. The responsive records included personal notes of the government entity's employee. Are these notes public? Notes are not public if they are personal in nature, kept by the employee merely to assist them, and not shared with anyone in the department, and are not maintained as part of the department's files. That exemption is directly on point, and the example speaks specifically to the matter at hand, as all that currently existed was the recording secretary's personal notes that were created to assist her in preparing the minutes for the school committee. It is my recommendation the committee authorize me, it actually would be a letter from the chair, I believe, a letter to the chair as the complainant, citing the open meeting law and public records exemptions as I had previously shared with the committee as the response to the open meeting law complaint as filed. I will note for the record that those minutes are now available both in draft form and certainly are part of the public record of this meeting. So I think it would formally need a motion from the committee to respond to the complaint as indicated in substantive form at this meeting.
Can I have that motion, someone? After. Put your mic on.
So I make a motion, we allow the superintendent, or is it the superintendent or the chair?
I think it really should be the school committee chair as the chair of the public body.
I make a motion, we allow the chairman to respond to the open meeting law complaint.
Second.
Yeah. Darlene, discussion?
Based on the dates that you just read off, and given, I believe we had until last Friday to provide the minutes. Have we not done that yet? Is that what you just said?
What I would say is we responded to the complaint contemporaneously. Certainly should the requester request the minutes again, we would be happy to provide them at this point in time.
Don't we have to give the minutes on the first request?
We didn't have them at the first request. That was the basis of the complaint.
No, I know, but we've had them now, so because we didn't have them then, but we have them now, they have to request again?
The open meeting law requires a response within 10 days, which is what we provided. And we had indicated that the minutes would be available when the meeting happened, which they are now.
No, I'm not talking about the open meeting law complaint. I'm talking about the original request to get the minutes.
No, we have complied with the law as required.
Two different. I don't agree, but okay.
Jim? Mike? Annette, anything? All right, I'm good. There's a motion on the floor. All those in favor?
You need a second first.
I seconded it.
Oh, okay.
Yeah.
Sorry, Jim, didn't hear you.
All those in favor?
Aye.
Aye. Opposed? What was the vote?
I'm in favor of the motion, but I would like the, but I would like you to copy in the rest of the board with the,
Response?
with the response.
That's
And make sure that it, I know I had mentioned to Tim about it, and he said we didn't want to spend money on legal, but, you know, I want to make sure that the response, you run it by Mike Long or somebody that we're.
All right, that's easy. I'm talking to Mike a lot these days. Okay. Item number 8, executive session. Tim, do we have a need?
There's actually not a need for executive session this evening.
Thank you, God.
Okay, I will entertain a motion then.
Motion to adjourn?
Second.
All those in favor?
Aye.
Aye. Good night, everybody. We'll have a meeting probably next week, and we'll notify as soon as possible.
Been talked about so vociferously in a long time, if ever, in a mayoral race.
Yeah, it's really interesting. As you say, it's about half of voters who identify as moderate or conservative. Most of that half is moderate as opposed to conservative. And they will have a real influence in this election. I think Anissa Asabi-George, who has set herself apart as the one candidate who's not identifying as a progressive here, is really banking on that vote, and we'll see how much she can draw it out. I think there's a very interesting kind of cross-current here around race. A lot of people, for instance, have pointed to the New York City mayor's race, the Democratic primary down there, where Eric Adams won the Democratic nod, and he was a former police officer. He was more focused on kind of a moderate message, and he was able to win that Democratic primary. What he had going for him in part, of course, is he himself is black, and he was able to win over a lot of black and Latino voters who in many cases are more moderate or more conservative than a lot of white voters. I mean, it was white progressives in Manhattan who were going for different candidates. And here in Boston, we see a lot of liberal white voters getting behind Michelle Wu, for instance, and some of the other liberal candidates. And so there's a dynamic there. Anissa Asabi-George, who does identify as a person of color, her father emigrated from Tunisia, nonetheless has struggled to pick up black and Latino votes in some of the polls. And so will she be able to win over some of those more moderate black and Latino voters who might naturally cleave to someone with her positions, or will a more progressive candidate of color be able to pick up some of those voters of color, even if they don't align exactly in terms of their politics? So I think that's really something to watch here.
We're talking to David Schaffenberg. He's an editorial writer and staff writer for the Globe Ideas section. You know, David, the Globe did a pretty devastating piece about Anissa Asabi-George's husband and his, I guess you could say, the very best checkered history as a developer in Boston, you know, not following the rules, getting criminally charged, having porches fall through, evicting tenants. Does that matter to... As the mayor, of course, the mayor of Boston, you have tremendous power over development in Boston. Do voters care about that or not?
It's a good question. I mean, I think it certainly does matter in terms of her standing as a city councilor and as a potential mayor and such. So something people should certainly take into consideration. Whether it plays out in the election, I'm not sure. She was one of, a half dozen moderate candidates and to choose from, and moderate voters might push her aside for someone else after a story like that. But given that she's really kind of standing alone, I wonder if her voters who consider themselves more moderate or conservative and see her as their sort of lone representative in this field, if they'll really be turned off or not. I mean, I suppose it could dampen some turnout, folks who might just not vote at all. But I wouldn't be surprised if she does quite well in this preliminary election, even if she doesn't make the final. But I certainly think she has a shot to make the final.
Let's go back to a little bit about how realistic some of these, the proposed measures are and some of the conversations are. As you pointed out earlier in this conversation, anything involving the T would have to, that's not under the guise of the mayor, under the purview of the mayor of the city of Boston. A lot of things that these candidates are talking about would need legislative approval. You point out in this piece there's a lot of conversation about housing, but Boston seems to have done a lot already around housing, which is also nice to hear, especially in the affordable housing realm. So, going forward, we also know that campaigns drum up a lot of ideas, a lot of interest and things to talk about. Not all of them, and often few of them actually materialize. So forecast for us what could come to fruition here.
Yeah, I think it's going to be a bit of a mixed bag. There are certain things that a mayor will be able to push ahead on, advocate for. I mean, it's interesting. In the Boston Globe poll we did a couple of months back at this point, police reform and crime, for that matter, did not register terribly high in these polls. It's not something that voters seem overly concerned with. So if you're an Andrea Campbell, for instance, who's really pushed this issue, if you're elected mayor, is that something you want to hammer on? If it's something that doesn't feel like an urgent issue to the voters? So that'll be a political question there. If she or another reform-minded candidate or mayor rather decides to push forward, well, there are things you could do there. You could make trims if you can bring the city council along in the police budget. You could make some real shifts in how we handle mental health calls, school discipline calls. So there are places like that where you can make a real impact. Zoning, for instance, and then there are other places where it'll be a struggle. You mentioned housing, Jared. I mean. I think there's a little bit of a deficit of ideas on that front, even among this very progressive field. I quoted a national housing advocate saying, well, in this field, we haven't had a lot of money. We've sort of patched things